We have been engaged in community outreach since the fall of 2014, prior to our Phase 2 applications with the city in the spring of 2015. Since filing, we have continued outreach efforts and we are committed to have an open dialogue about our Phase 2 applications throughout the city entitlement process. As you consider our Phase 2 application, I would like to underscore that our Phase 2 planning has been driven by our assessment of community healthcare needs. All of our Phase 2 buildings are essential to meeting the growing healthcare needs of the community. I also want to mention timing. The first stage of our proposal includes a new home for the John Wayne Cancer Institute. Building a new modern research facility is critically important in our desire to move forward to our next stage, environmental review, as soon as possible. So I'll turn over to Paula.
Thanks. The context for tonight's hearing is very important. St. John's is a nonprofit health center that serves our community. We all benefit from it. They're midway through their multi-decade effort to rebuild and expand their hospital and healthcare facilities. The planning effort began shortly after the 1994 earthquake, when there was severe damage to St. John's, and they had to close completely for 9 months to allow temporary seismic repairs. The plan St. John into a 21st century health center. The effort culminated in city approval of a development agreement in 1998. As Roxanne mentioned, the DA provides vested rights for 2 phases. First phase is now complete. It resulted in the core hospital facilities being reduced substantially by about 187,000 square feet and 236 licensed beds. That's the old hospital before you. This slide shows the new hospital facilities north of Santa Monica Boulevard, as well as the Phase 2 development sites, with the John Wayne Cancer Institute existing south of Santa Monica Boulevard and the Child and Family Development Center on 20th Street. For the second phase of the development, the DA focused on health and wellness, as well as medical research and Child and Family Development Center. The DA provides vested rights, including floor area for the South Campus and a minimum open space of 35%, vested floor area and height limits for the North Campus, and vested uses that permeate both the North and South Campus. The Phase 2 applications that the architects will describe to you next are consistent with all of the DA's size and scale parameters. The planning team purposefully developed a plan that accommodates the critical healthcare needs and programming, but also respects the DA's parameters. Again, no additional floor area is being requested, even though the zoning ordinance would allow greater development. The DA also specifies community benefits for Phase 2, an expanded community access plan to ensure low-income residents have access to the Phase 2 community-oriented facilities, an expanded child care program. The only potential DA amendment that's being requested is to implement the plan more slowly. I'll speak to this later after the architects discuss the plan.
Good evening. My name is Suzanne Jaggers, and I'm a healthcare planner with Perkins Eastman Architects. We're partnered with Moore Rubel Udell, who's an architectural firm here in Santa Monica. When we started the project 2 years ago, we really started it under the framework of the DA. And in the DA, there are 7 different areas of which there can be different types of facilities built on the site, 7 different types of uses. Underlying all of these uses are, in fact, parking that supports those uses, and that is the 8th use that you see in front of you. When we started the project a couple of years ago, we started it off by going through a visioning session, and we involved the leaders of the hospital, community members, researchers, and physicians. And from that, we came out with a series of key goals. One of the first key goals, as mentioned previously, is the replacement of John Wayne Cancer Institute. It's had a 25-year history with St. John's. It's a world-class cancer research center, and it's in a facility that is not capable of taking it into the 21st century and extending really the research that is being done there today. So when we looked at John Wayne, we saw a huge opportunity to actually translate the research that's being done there, the medical research, and translate it into the medical care that wants to happen on the campus for St. John's. And so we are looking, as we vision into the future, we're looking for a place where we have translational research into translational medicine. So imagine that you are a breast cancer patient or a patient who has prostate cancer, In the future, when you go to St. John's, you will be able to visit your oncologist and have a visit. You may have minimally invasive surgery on the campus. You could have chemotherapy as treatment. Or more importantly and more excitingly, today you could have immunotherapy treatment, which is one of the areas that John Wayne is excelling at, a new area of development in cancer study. You could become a part of a clinical trial and increase and improve the care for other cancer patients. When you're moving in the path to wellness, we're going to be offering rehab services. So you could go through rehab and find a path to wellness. And you may be doing rehab next to the cardiac patient, and they're doing cardiac rehab, or the sports medicine patient who's doing rehab, or the joint replacement patient who's doing rehab. You may also come to the campus and experience some of the other specialty care that's there. So whether it's neurosciences, women's health, children's health, or cardiac health, you can come to the campus and also receive that care. We also think it's important that the patients, when they're on campus, have an opportunity for medical education, education about wellness, education about their disease, and education that will help them to a path to wellness. So we have a centerpiece on the campus that is actually an education and conference center, and the idea for that conference center is to provide educational opportunities for patients, families, and for staff, and staff to have continuing medical education, to hold symposiums, and to provide opportunities also for the community to use the conference rooms and auditorium that is planned on the campus. And I'm going to allow James to talk about the other vested uses and how they may deploy on the campus.
Okay. Good evening, everybody, commissioners, council member, commissioners and chair. We're right in the heart of Santa Monica here, the urban fabric, and it's very well served with the new light rail, public transportation, two new stations, the 17th and well served with bicycle. It's quite well served with bicycle, but could be improved, and it's also well served with bus, the Blue Bus. A big idea, I think, when we first looked at the site is the site is quite a large site, and it's developed into a much larger site over the years, and it's become a block. Initial idea was, say, integrate two new roads, propose two new roads north-south, and what that would mean would be better pedestrian access, better cycling access, better vehicular loading, and better movement, more porous, kind of opening up the arteries of the city, and better for the neighbourhood and how it connects. The next big idea was, how does this campus work? It could sit on a series of landscape areas, open areas, that bring and welcome the neighbourhood in and have public serving, public orientated retail and connect with the neighbourhood and all the people around. And then how do we connect north and south campus? We're looking at connecting it with what I'm showing here is a red line, a wellness walk. A walk that connects all landscape and outdoor spaces, north and south, for exercise, rehabilitation, movement, for neighbours, strolling, easy access, and exploring the outdoor spaces. But on a larger level, where do buildings really need to belong functionally? We have the existing hospital on Santa Monica Boulevard, acute care, research, ambulatory, and ambulatory care needs to be close to the hospital. Other uses make sense: childcare, child and family development, and housing. Broadway. That's more the neighbourhood scale there. So let's put all of those ideas together on one plan, and that's what gave us the sites for the buildings. How places would start to feel. On 20th Street, we have the only above-grade parking. On the south and north, we have below-grade parking, but the only above-grade parking is on 20th Street, which is mainly for our staff, hospital staff. Now let's look into the plan itself. The orange buildings or brown buildings there are all the medical buildings. Close to, as I mentioned, Santa Monica Boulevard. We've broken the number of buildings up into 5 buildings throughout the campus, but then closer, when we look closer, we've broken the buildings up even further in terms of the wellness walk taking you through. So the idea is that for a patient or a visitor, you don't have to walk through the buildings. to walk into the plaza. You can be dropped off. You don't have to walk around the buildings. There's easy passages through. So it's broken up again. The two new streets also restrict the size of the buildings. They pull back the actual building areas. So they're smaller. And it's all connected with this outdoor space. That's the Wellness Walk. And then to the north, and Roxanne talked a little bit about it, we aligned the north-south streets, the two new north-south streets, with the driveways and increased the driveway dimension so that you have an alignment throughout. Circulation is kind of continuous. A little bit about the heights. The existing higher medical buildings are on Santa Monica Boulevard. 110 feet to 168 feet being the higher buildings. The buildings that we're proposing for the medical buildings are between 5 and 6 floors. Medical buildings tend to be higher than residential buildings and other uses. They're typically about 17 feet. We have a range between the 5 and 6 stories to 75 to 105 feet. And then towards Broadway, where it makes sense to have lower buildings, we're 1 to 6 stories there in terms of residential and the childcare and Child and Family Development Centre, and a range there of 1 story being 15 feet and up to the maximum of 73 feet in terms of height. And then looking a little bit closer, what does it feel like on the ground? And so a little bit about the open space. We have a minimum setback of 15 feet in terms of Broadway or Santa Monica Boulevard. But mostly it's much larger open space that is activated either by the plaza here towards Santa Monica Boulevard or the garden and retail serving areas on the southern part of the campus, where it's much larger open space. And then Paula Larmore will talk about the parking.
So St. John's has taken a holistic approach to parking, looking at both the Phase 1 and Phase 2. As Roxanne mentioned, it's a demand approach to parking, and our parking consultant is here with us if you have any additional questions. At the end of Phase 2, all of the parking will be on-site in St. John's own facilities. The implementation plan is over 5 stages. St. John's thinks this is necessary in order for it to stay fully operational, including that the John Wayne Cancer Institute and the Child and Family Development Center need to be built first before their existing facilities can be demolished. We need to have sufficient parking throughout all stages of implementation. St. John's would like to maximize the on-site staging to minimize impacts on both neighboring residents and businesses, as well as its own operations. And they also need to provide sufficient time to raise the charitable dollars that will be needed to implement the Phase 2 plan. The model before you shows the existing Phase 2 campus, but we have the pieces and we can go through the staging plan with you if you would like as part of the questions and answers. The elongated implementation plan is St. John's only request to amend the development agreement, and we believe the Commission already has the discretion to approve the elongated schedule. The City has requested 4 amendments. Roxanne discussed them, so I'm going to move to the charts to kind of show the changes visually. St. John's proposal is the South Campus Master Plan with 8 development review permits, 1 for each building, and that these would all be approved kind of up front. The master plan would be first, and then the 8 development review permits. And then the development review permits would have different time schedules based on the different building to obtain building permits, ranging from about 2 years to 19 and a half years. Just to provide you with some context, this commission has approved, and the council has also approved, time periods to obtain building permits for 6 to 10 years for other campuses, such as New Roads, Crossroads, Carlthorpe, also St. Monica's, and the 710 Wilshire Hotel. This is the city's proposal, city staff's proposed alternative, which is a Phase 2 master plan rather than a South Campus master plan, and then approving development review permits for some of the buildings up front with extended time periods, with deferring the later buildings to but instead replacing them with vested rights instead of approving instead of approving development review permits. This kind of shows the process that's outlined. The left side shows the development agreement process that's currently outlined, and the right process shows city staff's revised process, and I'm happy to answer more questions. And overall, Providence St. John's is open to considering city staff's amendments, so long as they do not result in a reduction of the Phase 2 vested rights. The program has been planned strategically, and we feel that every square foot is justified and is critically important to the healthcare mission of St. John's. It's also important that we don't have a further delay of the Phase 2 entitlements process. St. John's filed the applications over a year ago, and we're just now here before you for a float up or a preliminary hearing. We also then need to go to City Council and then start the long environmental review process. As you consider the other request from the staff, which is community benefits, we ask you to consider that St. John's itself is a benefit to this community. In 2014 alone, St. John's served over 16,800 Santa Monica residents. St. John's also has a very substantial community benefits package, and it's ongoing. They report annually to the city. This is different than the typical development agreements you've seen, where it might have a couple $1 million of upfront one-time fees. St. John's has community benefits in the millions of dollars that are ongoing and reported each year. When you look at the numbers, consider that every number that you see in terms of St. John's community benefits is only an annual number, not a cumulative. The DA already requires increased community benefits for Phase 2, including a 35% open space. Again, as a frame of reference, you're right now thinking about 20% for the largest sites in the downtown. Phase 2 programs are also benefits themselves. The John Wayne Cancer Institute and the ambulatory services that were described earlier are benefits to us all. Phase 2 implementation is also a benefit in terms of urban planning and integration. The Phase 2 sites are currently mostly surface parking lots. There's no integration between the North and South Campus, and if you want to get to one, you basically have to walk all the way to 20th or 23rd Street. The two new streets will facilitate better circulation in the area, allow people to get from the Expo line from Broadway up to Santa Monica Boulevard in terms of cars, bicycles, and walking. This will add landscaped open spaces and state-of-the-art health and wellness facilities, as well as the additional community benefits we just discussed. And as a point of comparison, Tier 2 zoning would allow over 100,000 square feet more than is being proposed. So when you think of community benefits, think of us as a Tier 1.5 project. Thank you.
Ms. Larmore, before you go, I think you said that you could show us on the model the
Yes.
staging. Could you do that extremely, also describe time frame as you put the bits of the model in place, please?
Sure. So James, are you going to be my Vanna? So first stage is to develop the John Wayne Cancer Institute. The first stage and the first shovel in the ground is for parking on the campus. And that's the west side of the campus. So the surface parking will be developed first, and then the John Wayne Cancer and the Child and Family Development Center can come on top of the parking.
So what you are in fact saying to us is you're going to dig and put some parking in place underneath those buildings.
Yes.
What is the time frame on that?
We're requesting 1.75 years to obtain the building permit. The construction schedule, I'd have to pull up in our backup slides. Can you guys pull up the construction schedule?
That was 6 to 10 years.
So the parking is anticipated to be completed 15 months after we pull the building permit. About 3.5, 4 years.
4 years, I believe.
4
yes.
years, yeah. Doing math on the fly.
And then the building itself would arise.
And then the Child and Family Development comes on, and I'm sorry, these are all in months, it's going to be hard, but would come on in 18 months after the, the Child and Family Development Center. About 19 months after the parking.
It's approximately 6.5 years.
Yes. And meanwhile, the multifamily replacement housing is also being developed. It's on the other side of the campus, and it can be developed kind of as an independent.
And parking is dug
project.
underneath that to
And
start
parking is dug underneath that to start with.
with. So these 3 buildings would come out of the ground in approximately 6 years after you get permission to move ahead.
Yes, I'm sorry. This chart shows the number of years on the top of it. If you
So
can
that's
read
the
it.
first phase.
Yes.
So there's some parking underneath those buildings, and then the 3 sets of buildings come up in 6 years.
Yes.
Move to the next phase.
And then once that's done, the Child and Family Development Center is now open, so you can demolish the existing Child and Family Development Center on the North Campus and replace it with underground and above grade parking. Now that structure is critical to get parking in on an early stage because the next stage of development involves removing almost 350 spaces.
So that building is 6 years away after you get permission, and then it is constructed over what, 2 years?
Yes, by the time it opens, it's about 9 years out from approval.
So 9 years after you get permission, that building comes up out of the ground.
Correct.
Correct. So that's kind of the second phase. The third phase is
The third phase is now that the parking structure is open, we can take off the the John Wayne Cancer Institute and the east surface lots, dig parking,
you dig lots of parking there.
digging lots of parking there, maybe less if we can reassess the parking at that time,
And maybe not.
and
too.
then maybe not. It'll be based on empirical data at that time, and we'll have light rail open. So
So
we'll
how
be
long
able
does that
to-
take?
And then the visitor housing would be open in about 14 years from approval, and the East Ambulatory building would be open about 15 years from approval or approval of the master plan, whether it's a DRP or the master plan. It's
And
just
at that
going to
point, the
times
South
zero.
Campus is complete.
At that time, the South Campus is complete with all of its open space and its
Right.
2 new roads.
So that's 15 years away from approval.
Right.
What then remains?
Then the 2 North Campus sites can be developed.
Could you show
The
where are they on the plan?
the 2C and 2D.
And they both have parking underneath them.
They both have parking underneath them.
And one building is before the other. Is that correct?
Yes, the 2C, the west building, comes first.
Uh,
With the widened entry plaza so that we don't have 4 different intersections along.
Right. So
St.
when would that
John.
parking be dug?
That parking would be dug starting digging in 14 years out.
14 years.
And it would, from approval, and then it would come on, the whole building could come online about 19 years out.
19 years, almost 2 decades after you get approval, right?
Yes.
So put that in place, and then
And then we started building the parking, and then there's a 48-month construction period for the last stage, and you're taking it out to about 23 and a half years.
I see. Thank you so much for that. Commissioners, do you now have some questions for Ms. Larmore? Thank you very much, James. Commissioner Anderson, you start.
Just a quick follow-up to what you were saying. So the rearrangement of the entry plaza in the North Campus, when does that happen?
So maybe we can go back to a site plan. Pull up this one. So the new road on the west side comes online with those 2 new streets. And new road on the east side comes online with those 2 new streets, but with those buildings on the east side. So the plaza, I believe, would get widened at the end unless we negotiate with staff that it would come earlier.
So the plaza gets widened at the end of the 25 years,
When the 2C and 2D&E sites redevelop,
and you said they're 15 years away.
right?
I see.
19
years
yes.
away, yes.
Again, that could be up for discussion with staff. This concept of the widening of the driveways
Of course.
is something that's up for your discussion. So before we got into the details, we wanted to get the blessing that everyone wanted us to do this change to the DA.
Commissioner Parry, do you have some questions at this time? Commissioner Newbold? Anyone else along here? So Now is a good moment.
Nice, Chair. So basically, just to wrap up what you were just saying, it is possible to reorganize when the streets and the circulation things come online.
On the North Campus, yes. It's just that those sites are currently developed with surface parking, so we would just need to make sure that by widening the driveway and displacing those parking spaces, we would have parking for them in the new Phase 2 facilities.
Fair enough. And is there any way to consolidate any of these phases, like even the ones happening on the North Campus at the end, so that we can maybe bring it back and shorten things and have less of a drawn-out construction experience for the neighborhood?
I think so. We've requested the maximum time to obtain building permits. Definitely, if we were able to raise the funds and keep the hospital in operation, there would be opportunities to bring them forward early. There's also mitigation that's going to be tied with them. Again, going back to making sure we're satisfying the parking, and basically all of the Phase 2 sites are developed with surface parking lots. So this is the maximum time being requested. It could come earlier, subject to all those mitigations
Right.
in place. And actually, just the neighbors also weren't complaining about staging the construction because it jumps around. It's not like you're going to be under construction for a 25-year period on any portion of the campus.
Right. It would move around.
Right.
So I have questions about other things, more broader topics. Things like, since we're talking about the whole thing, it says in the DA that you have 5,000 square feet that could possibly be bank, and then another 5,000 square feet that could possibly be neighborhood commercial. And, we talk a lot about active streets and interest at the pedestrian level. And what is the likelihood that you're going to actually use 5,000 square feet for a bank at this point, so many years later? Is that still a big issue, or could it be that maybe we say 10,000 square feet could be neighborhood commercial and up to 5,000 a bank, and still have St. John's meet its commitments, if any, to U.S. Bank? You see what I'm saying?
So we don't have any commitments to U.S. Bank, actually. The reason why the foundation building, the bank building is now the foundation building is per the DA, St. John's was not allowed to extend the lease with U.S. Bank. And so we're not proposing any bank. Even though it is a permitted use for Phase 2, we've only proposed the neighborhood commercial uses and the health-related services.
So we could perhaps propose saying that 10,000 square feet could be used for commercial purposes to activate streets along Santa Monica and Broadway, and that would give us more flexibility when we're looking at the master plan, and that wouldn't mess with things.
No.
That's good to know.
So, Commissioner, I think what will be a little different tonight is it's clear that we have waves of questions. We've got a wave about master plan. So
Right, well-
you can save your questions if necessary, and we will come back to the applicant later on if that's important to either you or the rest of the commissioners.
Well, another thing that I wanted to ask her is, you specifically said in your letter that you didn't want to have to do more open space. Was that because you don't want to constrain the footprints of your buildings as you're conceiving them, or do you have some other aversion to open space?
No, it was that the DA requires 35% on the South Campus, and the language that was included in your staff report, which changed the South Campus master plan to a Phase 2 plan, basically took all the South Campus, struck it, and replaced it with Phase 2. So my understanding in speaking with staff is the intention was to keep all the substance of the original DA and not change the requirements, but the language does. It extends the 35% minimum open space to both the North Campus and South Campus sites, and the North Campus as already developed with open space, and 35% is very generous on the South Campus, and we do feel that it's necessary to not have 35% also applied to these 3 North Campus sites.
So it has to do with the fact that you would have to actually have more open space than you have now because of,
Right.
okay, I
And
understand.
just one other clarification is the 2 new streets don't count towards open space, so it already kind of narrows the footprints of the buildings on the South Campus.
Right, that makes sense. Wait, hold on. I'll save some of my community benefit ideas, but
You can save anything you want.
I have another idea or a thought. Well, I'm thinking a lot about those 10 units of housing and how awesomely dreamy it would be if they could all be affordable senior housing. And I'm looking at that lovely affordable senior housing building right smack dab in the middle of your project. And maybe there's a way to enter a negotiation. We have time, maybe, I don't know. Looks like there's a lot of time in that schedule to look at a negotiation or a partner or a way. I mean, they have things they need, like parking spaces. You need somebody to help to deal with your housing, because I understand that you're not in the housing business. I don't know. So I would just like to really see something like, a deeper level of negotiation. And I'm wondering, basically, have you ever done that before? And do you have partners in mind for that? And what was the plan for that building? You were just going to build it and hire a rental company, or what was the deal there?
I think we haven't got that far into the thinking. We've had an initial conversation with the local nonprofit housing provider, and if that is one of the community benefits that this commission and the council ultimately indicate to us is a significant priority, we would further those conversations. But for us, it's kind of trying to get the whole list and think about where the priorities fall
I see.
from the city's perspective.
Right. So, okay.
And then the parking, I also think it's something the city could do in the meantime to help out Geneva Board, and we promised them that we would convey our support for that.
Beautiful. I'll ask about the community benefit subtleties in the future, but those were my big ones. Thank you.
Thank you.
So the planning department and the city have proposed an alternative to what you have put forward. Are you willing to accept what the planning department has put forward as the basis of going forward?
At a concept level, we're open to discussing it. I think there's a lot of details that need to be worked through and discussed with staff.
Such as?
Such as we would need to make sure, because we'd be building, for instance, the child care facility in the first stage of development for all of the phase 2 program, that we have vested uses for those later stages, that they're clearly defined. On the city's perspective, I think they're going to want a commitment that those later stages, the roads happen, the widened driveways happen. So I think there's just a lot of details to work through with them.
But it does not seem to me from what you just said that you're in disagreement. What you're saying is, as part of the DA agreement, you would need to have specific entitlements, and the city would have specific entitlements, which would obligate you to do things. Is that correct?
Correct.
Because we did have a disagreement a little while ago where St John's said they had the right, but not the necessity, to build parking. And this keeps going through my mind. Perhaps it was the lawyers who were involved, the $800 or $1,000 lawyers, but we wouldn't want that circumstance again, either from our perspective or yours, would we?
Correct. And I think the difference was the original phase 1 hospital had to be built in pieces, while the old one was demolished in pieces. And so you could not build subterranean parking first, because the existing facility was there and that St. John's had to maintain in operations. Here, you're building subterranean parking before you put any of the buildings online. So with that respect to that particular issue, that's easily resolved, because we can't build the new buildings without the parking. But I agree, there are mitigations that both the city is going to be wanting to be very clearly outlined, and for us, we want to make sure the vested rights are very clearly outlined.
At one point you said in there, or somebody said, that the buildings and the plan could move quicker should the charitable dollars be raised. This may be more appropriate for the CEO. What is the likelihood that there will be the amount of capital raised more quickly? And second, what is the sum of money we're now talking about to build this out? Mr. Lowe?
Sure, go ahead.
So really, there's probably three sources of funding for this project or projects. One is obviously with the sponsorship of Providence Health and Services. There's strategic capital that is prioritized for these types of projects. The second one would be operational capital that would be generated locally with the revenue associated with St. John's and the John Wayne. And then the third, obviously, is the community through the St. John's Foundation. Many of you know there was a substantial amount of money that was raised for St. John's to build Phase 1. And obviously, there's an intent and certainly a commitment on the part of trustees of the foundation to be very supportive of helping to do that in the phased approach that's been described. I mean, if you look at it in the contents of overall costs, I mean, this is a high-level estimate. It's probably over $2 billion over the length of the total years we're talking about.
Right, $2 billion. So do you have 50 or $100 million? I mean, do you have enough to start the phase? So what's the likelihood of phase 1 going ahead if we give you the go-ahead?
Well, in the contents of where you look at the time it's going to take to finally put a shovel in the ground, we think it's a strong likelihood we'll have the resource available to begin.
And you've done this before in Seattle. You've constructed a hospital.
Right.
So once you begin the process and you've got some certainty, if you get that from this process, what then happens? Do dollars start to flow more quickly after a while?
Yeah, I mean, it depends upon the donor, but obviously donors like to see progress. And so, in my experience in Seattle, certainly that helped generate, acceleration of giving based upon the interest of the donor.
So do you think it's 25 years, or are we talking 20 years or even less?
It's hard to guess. I haven't been in this community long enough to assess all of that, but I think your point is if we were more successful in raising money quicker,
yes,
that would help accelerate our plans, certainly.
Right. And is that part of your thinking at the moment then? When you're looking at this project, are you thinking it will be finished more quickly?
Well, I've been based upon, the plan that we've submitted here, so I haven't thought about whether it could be done more quickly. My preference would be we could get it done more quickly, but...
Really?
Yeah.
All right. Thank you.
Yeah.
If there are no more questions, Commissioner Kennedy.
I've got a question. At what point, so we just heard that, there was fundraising taking place for Phase 1, and at what point did St. John's realize that when that was nearing completion, and I'm not sure that's the right way to say it, but at what point did St. John's say, we're not going to get enough funding to get this done in the time allotted? Was it... and so we're not going to fundraise now? Or has fundraising been constantly ongoing for Phase 2 and it's just difficult because for example, the progress can't be demonstrated or at this point? I'm just trying to figure out, was it like 10 or 15 years ago that you said, well, we're not even going to start raising for Phase 2 yet?
So I think a big part of it is the change in sponsorship. I think there may have been one or two early meetings with the prior sponsor about Phase 2, but nothing ever kicked off past that. The Phase 1 facility is all governed by the state. It wasn't through the city's building department. It was through OSHPD, through the state. And so it took a lot longer, and St. John's had to request several extensions to get the Phase 1 facilities built. When the new sponsor took over in 2014, early 2014, that's when the Phase 2 planning really commenced in earnest.
So St. John's knew years and years and maybe even decades ago that Phase 2 wasn't, the money for Phase 2 wasn't even close to
I think the administration, again, they had several kickoff meetings. They would have liked to, but they did not have they were not given the financial resources to fully develop a Phase 2 plan.
Okay, thanks.
My final question, you keep using the word sponsor.
Yes.
What in this context does sponsor mean?
That's a question for Marcel.
In the contents, it's owner.
So
So
Providence,
being a Catholic healthcare system, a lot of times they refer to as a change of sponsorship from one Catholic entity to another, which is what the circumstances here were. But in the contents, obviously, Providence Health and Services is the owner.
why is Providence then a stronger sponsor than the previous owner?
Well, that's a good question. Well, Providence, I think part of the advantage that there was alignment with having Providence take sponsorship of St. John's is we had 5 other hospital ministries in the LA market. So there was that kind of alignment and scale to provide a lot more aligned resources to St. John's than what the Sisters of Charity, who is located in Leavenworth, they only had one hospital in California, and it was St. John's. So the distance and just the difference in markets and that sort of thing, it really drove a little bit of what Paul is talking about, is they weren't sure they wanted to make those kind of investments here. So it caused a lot of years of delay and non-decision, I guess, is how it went.
Does that mean that greater capital resources are being invested by Providence into this hospital?
Exactly, a lot of capital resources.
Does it also mean this hospital is part of a wider network of hospitals which would enable specialities in other
Yes.
regions to come into play for patients here?
Yeah, so St. John's is part of the California region of Providence, which currently is at 6 other hospitals, ministries we call them. And then you might have been reading as well is that St. John's and Providence Health and Services and St. Joseph's Health are in final discussions of a partnership as well. So how that could benefit St. John's especially is on the research side with the John Wayne Cancer Institute, because it would give us the opportunity and also give access to our patients, the access for clinical trials in cancer and other research entities.
But you appear to have great strength in cancer. In other specialities, super specialities, would they be developed on other campuses, hospital campuses, and then allow people from this hospital to go there and receive that treatment?
Yeah, there
Automatically.
There has been some discussion, as you know better than I do, the geographic proximity of traffic and boundaries and that sort of thing makes that a little bit difficult. So, I mean, as you heard earlier, we're not only focused on cancer, but we're focused on neuroscience, musculoskeletal, women and children's services. So, because on the west side here, we need to have that kind of access for our patients and community.
Thank you. Commissioner Kennedy has a last question, and then we'll...
A few minutes ago, prior to this last question, Chair McKinnon asked you a question about types of fundraising and the rate of fundraising. And one of your responses was that you haven't, been in Santa Monica, or you don't know the community long enough and to really assess. So can you tell me what kind of fundraising you do specifically in Santa Monica that's different from perhaps, say, regional or even in different states through Providence or some other way? What does your fundraising in Santa Monica look like? What are your expectations?
So normally when
I apologize. Can I question whether this question is relevant? I guess for a couple of reasons, right? One is that we have a house full of public speakers.
So,
and I'm just,
Commissioner, can I
and
just
I'm just wondering whether we can go to public comment.
Commissioner, I'm going to cut you off.
Please.
You don't have that entitlement. We have a respectful arrangement here that other commissioners are allowed to ask questions, and I'm allowing it at the moment. We do have a group of people who are here, but it's the chance to ask the applicant. Commissioner Kennedy, please.
The reason why I asked the question is because I expect you'll be doing fundraising from all types of places and all types of donors, and I wanted to hear about your plan within Santa Monica and outside of Santa Monica.
So normally, in my experience, is that when you enter in a phase where you want to begin a capital campaign for a certain project or projects, you first do for no better term, you do an environmental assessment of the potential of fundraising. And you might have an external consultant comes in that's an expert in that to help assessing, what is the capability of the community, where are the sources of that, and what is the potential when you're setting a target for what a capital campaign could raise. So I don't have the specifics of that. We haven't even started that process yet.
But it's local and regional and
Correct.
All over.
Exactly.
Thank you. Okay.
Thank you. If there are no other questions, we will move now to public comment. Each person that's called will have 3 minutes. You, of course, don't have to take all of the 3 minutes. And if you feel that someone else has said something you wish to say, you don't have to speak either. So the first speaker will Madeline Gazazik, Lynn Corona. If you'd come to the... Is Madeline here? No. Okay. Lynn Corone, Joe Woods, Emily McCarron, and John Robertson. Please,
Hi, I'm Lynn Coram. I
Please.
don't know where the...
please start speaking.
Okay, great. I'm Lynn Coram, and I live at 1440 23rd Street in the condominium complex immediately east of Providence St. John's South Campus development. When we homeowners heard about the development, we arranged a meeting with the hospital's designer, planner, and other personnel. And they were eager for our feedback and listen to our comments. About 20 homeowners met with them in two separate meetings. In our first meeting, we expressed concerns about the 10-unit apartment building proposed immediately south of our southwestern corner of the building. As originally positioned, residents would be looking into each other's bedrooms and front rooms. We asked that the building be moved closer to Broadway and landscaping be planted between the two buildings. At our second meeting with the hospital's representatives, they showed us preliminary designs to do just that, which we were pleased with. Our second major concern is the proposed street, currently identified as 22nd Street, to run between our building and the open space with landscaping and partly underground parking. That has the potential to create noise for the 12 units facing the west. Perhaps making it a north-south one-way street would help. 23rd Street, which my personal condo faces, is north-south one-way parking, and it's fairly quiet. Finally, we will have to live with construction for more than 2 years, perhaps up to as much as 4 years, given the current schedule starting in 2019. I hope you will review rules for construction hours and not permit construction on the weekends. Thank you very much.
Thank you very much. Mr. Woods. Roxanne, would you mind pulling the microphone down, please?
Thank you. I'm Joe Woods. I'm president of Westminster Towers Corporation. I'd like to call your attention to my letter to Roxanne.
We know who you're talking
Roxanne, included in today's staff report. With the proposed changes to 21st Street, I'm concerned with the loss of parking and its effect on the seniors at Geneva Plaza. Geneva Plaza is a 100-unit senior residence located on the east side of 21st Street between Broadway and Santa Monica Boulevard. Geneva Plaza provides affordable housing for 135 residents. Geneva Plaza seniors need affordable permit parking. There is also a need for passenger loading and unloading zone and emergency vehicle parking for paramedics, ambulances, and fire in front of Geneva Plaza. I ask your consideration in solving the affordable permit parking and emergency vehicle issue.
Thank you very much.
Thank you.
Emily? Emily McCurry? Are you the first speaker? Madeline Gdazik? Yes, please.
My name is Madeline Geidzik. I've been to St. John's several times in the last 6 years. I was an inpatient when I underwent surgery for cancer. The advanced treatment and excellent post-surgical care I received at St. John's gave me a sense of security and the feeling I was part of a community of healers and healed. I am now cancer-free and indebted to the caregivers at St. John's for saving my life. In the year and a half since Providence took leadership at the health center, I visited the emergency room twice, once for a rapid and irregular heartbeat. At that time, I received immediate and excellent treatment and was admitted to the hospital for observation. And I thought, wow, they are so caring and considerate. And I felt that when I had cancer. I felt there was something extra. The people were special. I now take medication for AFib, which has kept the condition under control. My second ER visit occurred earlier this year when I was taken to the hospital for minor head injury. I fell in front of my home. I was rushed to St. John's ER, put through a battery of tests, got treated, and left very relieved. But so much for my organ recital. When you walk into St. John's, you see a display of their history and mission. While I'm not a religious person, it's assuring to know that they have a sense of a higher purpose and deliver care accordingly. The second phase of St. John's rebuilding process will allow the health center to expand on its mission and help create an environment for healthy living throughout the stages of life. For a senior Santa Monican like me, that's important. Please help them move forward. Betty Davis famously said, "Old age ain't no place for sissies." As long as St. John's has my back, I won't ever feel like a sissy. I'll feel like a valued member of the community. Thank you for listening.
No, thank you for coming. Emily McCarran, Mr. Robertson, and then Rebecca Refusiero, Brenda McDonald, Kristen Hill, and Jeremy Stutz. Please, Doctor.
Good evening. I'm Dr. John Robertson. I'm the Director of Thoracic and Cardiovascular Surgery at St. John's, past chairman of the foundation. I've been at St. John's for 27 years and live in this community. St. John's opened its doors October 25, 1942, responding to the needs of this community to have a community hospital. Something was desperately needed. Veterans were returning from World War II, and the hospital served those purposes. We opened with 89 beds, 35 bassinets. We've expanded considerably since that time and have developed many centers of excellence in cardiovascular, which has led the first open heart surgery, coronary bypass surgery in the world was done at this hospital. We're the leading center in the world in the Watchman placement. Our orthopedics divisions, 2 of our doctors are ranked number 1 and 2 in the world in joint replacement. The John Wayne Cancer Institute has developed many discoveries, including the Blue Node technique, which has revolutionized cancer care in the world. And of course, women's health. How many in this room were born at this hospital? So the hospital is a unique, remarkable community facility. This year, we are nominated for the 9th consecutive time as one of the top 50 hospitals in the United States, something that no other hospital in California has. Now, we remained in existence from 1942 to present. However, the earthquake in 1994 interrupted that care. For 9 months, we were shut down, and we had to consider whether it was worthwhile rebuilding St. John's. The community, the trustees, and the board of directors, and our parent agreed that it was. Our parent was somewhat difficult, but the people in the community wanted us to come back. We felt we needed to be there. Therefore, we reconstructed at the highest seismic standards available. Why? This is a seismically unstable area. We decided we wanted to build a hospital that would be a lifeboat for this community. So when the 9th earthquake strikes, and I think it will, perhaps in our lifetime, Santa Monica may be in shambles, but the hospital will be fully operational and there to serve this community. That's what we want to do. Now we're asking you to go forward. To remain relevant in this time period, we have to be able to develop new facilities. John Wayne is old. It needs to be expanded. We need new research facilities to bring in new techniques and bring in new doctors to this community. As a physician there, I strongly support this project and ask you to favorably consider the project going forward. Thank you very much.
Thank you for joining us. Rebecca Refusero.
Oops.
Welcome.
Thank you. Hi, I'm Rebecca Refuerzo, and I'm a licensed clinical social worker, and I have passionately worked at St. John's for the past 22 years as the executive director of the Child and Family Development Center. We're the building on 20th Street, next door to Horton and Converse, and we are, there are many mentions of child care. 10% of our work is child care. 90% is that we are a culturally responsive outpatient community mental health center serving 100% poor children, adolescents, and their families, and we've been doing that since 1962. Our work is child-centered and family-focused, and our multidisciplinary teams of clinical social workers, psychologists, and psychiatrists, occupational speech therapists, case managers, see approximately 1,000 different poor families per year utilizing evidence-based practice models. When I came to St. John's in 1994, I developed a clinic without walls, providing services in people's homes and schools in the wider community. We have therapists co-located at 10 different schools, 2 preschools, Venice Family Clinic, 5 transitional housing projects, and more. The City of Santa Monica, of course, Human Services Division funds CFDC to provide school-based mental health services at Olympic, Lincoln, John Adams, and Will Rogers. And we work collaboratively at Samuel High. CFDC is a home base for our employee-based child care and development center with a maximum of enrolled 51 children, which are infants, toddlers, and preschoolers. Remembering that if we increase child care, for every child we need 25 square feet unencumbered space outside. Lastly, CFDC is a nationally recognized training institute for clinical social workers and predoctoral psychologists. We have over 200 applicants annually, nationally, for 5 spaces. And I thank you very much. I probably be retired by the time my new building gets built, but that would be just fine with me.
Maybe your name will be on the door. Yeah. Brenda McDonald.
Good evening. My name is Brenda McDonald, and my husband and I have been residents of Santa Monica and participants in the St. John's community for over 33 years. I have been a member of the Irene Dunn Guild for 4 years, and I am currently serving as the president of the Guild. What is the Irene Dunn Guild, you're thinking? Irene Dunn was a film actress in the 1940s and the 1930s and 1940s, and she was a lifelong philanthropist, and closest to her heart was St. John's Hospital. In 1951, she served as the chair of the Guild, the Hospital Guild, as well as a foundation board member for many years. And then in 1987, she lent her name to the St. John's Hospital Foundation, and it became the Irene Dunn Guild. And this is a group which serves the mission of St. John's Hospital, which is to develop and implement, then support and participate in a variety of ongoing volunteer projects, events, and fundraising to support St. John's in the community outreach and service. To date, the Guild has raised over $20 million in support of these support services. I support St. John's personally because my husband has been a staff physician for 33 years. Our daughter was born there 23 years ago. And last fall, my husband was critically ill and admitted to the hospital. It was through the talent, the compassion, and the generosity of the staff of physicians and nurses that he is today alive and well. Our mission at St. John's is community-based, is community-oriented, outreach, education, and service, and the completion of the Phase 2 project will help us with our mission. Thank you so much for your time.
Thank you for joining us. Kristen Hill.
I'd like to pass in the interest of time.
Beg your pardon?
I'd like to pass in the interest of time.
Okay. Jeremy Stutz, followed by Megan Clark, Jane Cook, Carl Hansen. If I've called your name, please line up here on the right-hand side. Please, Mr. Stutz.
Good evening, Planning Commission. My name is Jeremy Stutz. I'm a resident of Santa Monica, now proudly living car-free in Pico neighborhood. I'm the president of Rail LA, a pro-transit nonprofit based here in Santa Monica. And I believe Richard McKinnon that is a Breeze Bike Share water bottle next to you. So I wanted to thank you for representing Breeze Bike Share here this evening.
Excellent.
Thanks. I'm a proud owner of a Breeze Bike Share water bottle as well. So I'm here today to share my support for an extension of Phase 2 of Providence St. John's Medical Center, a short bike ride away from my home. I know how fortunate I am to live here in a rent-controlled apartment in Santa Monica, but I'm aware that most of our workforce in Santa Monica, due to our lack of available local housing, are unable to live like I do, walking, biking, busing, and lifting around Santa Monica in short, easy, convenient trips. On May 20th, we will offer them an expanded range of options. The Expo line will roll into town, providing a convenient alternative for those who work in and serve our community, but currently have to sit in a log jam as traffic backs up exiting the freeway at Cloverfield, causing a headache for everyone. Very soon, any worker living along the Metro Rail network will be able to conveniently access our community car-free. In addition, St. John's proposed building housing for friends of family members of patients who may become temporary members of our community while someone they love is in the hospital. This is so important to give those struggling with a loved one's health crisis a place to rest their heads, rather than commuting from elsewhere, adding an additional car trip to our community. I'm particularly impressed by St. John's collaboration with Big Blue Bus to provide all employees with a free Big Blue Bus pass and optional Metro Rail pass, and most significantly, to provide a special Big Blue Bus route to shuttle all employees to and from the adjacent Expo line station, serving the community with times that align with employees' schedules at the hospital. The hospital is only a 10-minute walk away from Expo, but this bus service speaks to St. John's commitment to easing traffic impacts on the surrounding community, and their commitment to serving people of all physical abilities and disabilities. St. John's is in itself a community benefit, but the community benefits package that comes along with this project is really wonderful. Please give St. John's an extension so that they can move forward with their vision for a better hospital to best serve our community. Thank you.
Thank you. Thank you very much. Megan Clark. Great. Jane Cook. Same. Carl Hansen will be followed by Anita Zamora, Chris Backer, and Gary Bauman. Mr. Hansen.
Good evening, Commissioners. Carl Hansen, Director of Government Affairs for the Santa Monica Chamber of Commerce. The Chamber submitted a letter to you earlier this week expressing our strong support for the project, and I wanted to read that into the record tonight and touch on a couple other points. The Chamber is proud to support Providence St. John's as it commences the second phase of its redevelopment and expansion plan. Providence St. John's has been an important member of the Santa Monica community for 74 years and has provided health care to generations of Santa Monica residents. Phase 2 will allow Providence St. John's to continue their valuable work serving the Santa Monica community. In addition to providing an array of healthcare services, Providence St. John's will continue to provide substantial community benefits to Santa Monica residents. As one of the city's largest employers, Providence St. John's is an engine of our local economy. And Phase 2 will provide new jobs and contribute to economic growth in the city. For these reasons, we encourage you to recommend that the City Council authorize staff to proceed with the city's comprehensive review process for Phase 2. In addition to these points, I also wanted to raise one particular point of concern to the Chamber is Santa Monica was able to weather the Great Recession very well because we have a very diverse and strong economy. Healthcare is an important part of that, along with the technology and entertainment sector and the tourism. I think ensuring that healthcare in Santa Monica maintains a cutting edge and modern place is important as we encounter future economic uncertainty. As a young resident in Santa Monica, someone that eventually wants to raise a family here in the city, this is important to me as someone that one day will grow old here. I think having a spectacular healthcare facility like what's being proposed by St. John's is incredibly vital, no pun intended, but I encourage you to move this forward on behalf of the Chamber and myself as a resident. Thank you.
Thank you, Mr. Hansen. Anita Zamora.
Good evening. My name is Anita Zamora. I'm the Chief Operations Officer and Interim Chief Executive Officer at Venice Family Clinic. and I'm here to attest to the tremendous support that Providence St. John's has given us over the years. We are one of the community benefits recipients that works with Providence St. John's. So you might be familiar with Venice Family Clinic, but we're a community health center serving low-income, uninsured, and homeless patients across the west side of Los Angeles. And we have 10 service locations, 4 of which are here in the city of Santa Monica. So this includes a comprehensive primary care clinic called Simsman Health and Wellness Center on Pico and 25th. We also have a clinic at the OPCC Access Center and at Santa Monica High School. And we have the Common Ground Service Center, which is the only agency providing case management services for low-income HIV patients on the west side. Across all of our locations, we serve 24,000 unduplicated patients in over 100,000 visits, and over 4,000 of our patients are Santa Monica residents, and 1,000 of them are homeless. So I would like to share some of the many ways in which Providence St. John's is a tremendous partner for us in all of the services that we provide. They've been a supporter of us since 1981, so we're hitting our 35 years of continuous investment in the health of Venice Family Clinic. Providence St. John's leadership is very committed supporters of our work. Some examples is the Chief Executive, Marcel Lowe, recently joined our Foundation Board of Trustees, and this reflects a long line of involvement in our foundation boards. We also have close partnerships with other key leadership, for example, Sister Colleen Settles, who's the Vice President of Mission, Mary Luthi and Ron Sorensen in community benefits, and involvement from all areas across Providence St. John's. And over the years, Providence St. John's has invested $4 million, more than $4 million through contributions to our services. So some of the funds have supported things like homeless health care, teen services, Project Hearth, which is a partnership with other agencies to provide homeless respite services, a nurse practitioner clinic, diabetes care, general primary care, and other enrichment opportunities like pediatric literacy, just to name a few of the areas over the 35 years. And also a recent example of some of their involvement of being at the table in the work we do. They've been key stakeholders in an initiative we have called the Westside Health Access Program, which is addressing access to care for low income on the West Side. And not only has Providence St. John's provided funding to support what we call our specialty hub to provide services, but they've engaged their providers as well. I understand that's the end.
Thank you. Thank you very much. No, that is the end. Thank you so much.
Thank
you. Chris Backer, and then Gary Bowman, and Sister Colleen Settles, followed by Nancy Coleman.
Hello, I'm Chris Bacher. I'm the Executive Director of Meals on Wheels West here in Santa Monica. And we serve Santa Monica and the surrounding communities. I've been the executive director for about 2 years, but prior to that, I grew up here in Santa Monica, over on Bay Street. And I've seen a few changes in this town. I watched them dig the 10 freeway when I was in high school, and more recently, I've seen them put in the Expo. But through all those changes, the thing that I know is that St. John's has been a partner in this community. With Meals on Wheels West, many years ago before the earthquake, they actually prepared our meals in their kitchen. Following the destruction of the kitchen, they weren't able to do that. We moved on to another supplier, but St. John's stayed in partnership with us. We've had board members on our board. We've had people from St. John's serve for many years. In fact, Angela Vassallo is here today, and she currently serves on our board. And they've been such a great partner, we're considering adding a second board member from them. They also helped us with our strategic plan. So I think you'd find that across many sectors of the nonprofit world. You see that they work with, one of their focuses is on children. Venice Family Clinic, they work with them. So I think that their community benefits program has been a tremendous asset to this community. And I would urge you to, again, recognize that the building of Phase 2 will be another asset to this community, and I'd urge you to support it. Thank you.
Thank you very much. Mr. Bowman.
Good evening. It is a pleasure to speak to you tonight about Providence St. John's and its visionary plan to improve its property south of Santa Monica Boulevard. My name is Gary Bowman. For the past 8 years, I've served as the Director of Imaging, Radiation Oncology, and Mammography Services at Providence St. John's Health Center. I am proud to be associated with St. John's Health Center, which has served healthcare needs of the Santa Monica community for more than 7 decades. Its reputation for clinical excellence and award-winning care are just a couple of the many reasons I chose to become part of the St. John's family. Providence St. John's has received national recognition for a variety of services, including cardiac care, coronary intervention, critical care, orthopedics, pulmonary care, joint replacement, neurosurgery, and women's health. If you have been a patient at St. John's or have come to St. John's Health Center for diagnostic screening, it will come as no surprise to you that 99% of St. John's patients interact with radiology services. I would like to take a moment to comment on sustainability and transportation issues. I reside in Culver City. By car, my commute to St. John's on a good day is approximately 45 to 50 minutes each way. I am a great fan of the Expo line. I am also an experienced bike commuter. I look forward to the opening of the final leg of the Expo next month and to the day that I can cycle the first mile to the Culver City station, take the Expo to 17th Street, disembark with my bike, and ride the remaining short distance to St. John's. The Phase 2 goal of providing Class 1 biking facilities on both the North and South campuses affirms St. John's emphasis on maintaining a healthy lifestyle and underscores its commitment to sustainable practices as our health center continues to evolve. I appreciate your consideration of this long-range plan and hope you will adopt the city staff's recommendations. Thank you.
Thank you. Sister Settles. Then Nancy Coleman, Dr. Michael Kahn, and Daniel Galbamba.
Good evening. Thank you, Chairman McKenna and Commissioners. I'm Sister Colleen Settles, the Vice President for Mission at Providence St. John's Health Center. I'm a Sinsinawa Dominican sister, not a Sister of Charity of Leavenworth or a Sister of Providence. But I have worked with the Sisters of Providence for 33 years because I believe in their mission, and it so much connects with my personal mission and my congregation's mission. For the past 2 years since Providence has taken sponsorship, I have been privileged to be the Vice President of Mission to bring St. John's into the Providence family. St. John's was initiated when there was a need by the Sisters of Charity of Leavenworth, and recently, again, another need, and Providence has taken sponsorship to bring it into the future. One of the tenets of Catholic healthcare is that we take care of a community, and especially the poor and vulnerable. The poor and vulnerable are, as you know, in Santa Monica. They're more hidden than other populations, and it is our hope to bring health care to that population. We have done it over the past with the Sisters of Charity of Leavenworth by contributing to the already existing wonderful programs. You've heard some of them tonight: Venice Family Clinic, Meals on Wheels, OPCC, Wise and Healthy Aging. Many of those programs we contribute greatly to partner with them. We also want to bring our own outreach into the community, especially in terms of education to our community. Again, the lower income education as well as those who can pay for it. Our community outreach center, or our conferencing center, is so needed on our campus because we don't have that space right now. So the development of this plan is very vital to the education of our community, both those who can pay and those who can't find it anywhere else. Thank you very much for supporting our process.
Thank you, Sister. Nancy Coleman.
My name is Nancy Coleman, and I'm here today representing just myself. However, I serve on the Social Services Commission, and I'm a NOMA board member. I am really concerned about the Providence St. John seeking to become a world-class specialty hospital as it expands to more than 800,000 square feet with a significant impact on the community. It's not simply 1 square block, it's now 3.5 to 6 square blocks and nearly 800,000 square feet. This could become, for its specialty purposes, medical tourism. And we already have a lot of tourism already in Santa Monica, and the hotel part or the residence part is in the latter stages of the development. It's also for researchers as well as for families who might be visiting. I was also disturbed to find that the parking lot that's next to the hospital part of it is for staff. There's no parking around there for people who come to visit people who might be in the hospital. They've got to park at the south end of the project. But I think that it's really important to understand that in the last several years, the reports that have come in on community benefits have been incredibly confusing to the public. First of all, they confuse different dollars that were set aside perhaps by the city's human services program, perhaps by using federal or state or local dollars to express how those things are funded. So it's not differentiated in the reports that they do for their compliance with the DA agreement. If, as we go forward, they are to do this, we need to have unduplicated counts of who is being served that they are then attributing the charity dollars to Santa Monica residents. It's nice that they're funding lots of other things, that they're participating in lots of community boards, etc., that are within the West Side or perhaps otherwise, but they need to look at it from our perspective. They're building in Santa Monica, they're disrupting in Santa Monica, and they need to address that. I want to look specifically at what they state as community benefits. First of all, unreimbursed money from Medicare or from Medi-Cal is not a community benefit and should not be stated in the community benefits part of the program. I think. Okay.
Thank you very much, Ms. Coleman. Dr. Khan.
My name is Michael Khan, and I've come here to speak about the need to establish cycling on prescription as part of the community benefits of the hospital. I want to begin by continuing a little bit what the previous speaker spoke about double counting. The hospital is a non-profit. As a non-profit, is obliged to conduct a community health needs assessment, and that community health needs assessment is part of the IRS requirements for a hospital. This is not a community benefit that they can double count for Santa Monica in some manner, as they do in the paperwork that has been submitted. I want to go back a little bit to the whole horizon of medical benefits for the community that have been outlined. And what I've heard was, I think, best described when one gentleman spoke about earthquakes. It seems that medicine and wellness is all about earthquakes, new knees, irregular heartbeat, and cancer and other health catastrophes. I think the community, that is a very limited sense of what health and what a community benefit would be. Health is not when you have a broken leg or your heart is not working anymore or the cancer is growing and you get that sorted. That's not health. That's a catastrophe that needs to be sorted. Community health and well-being is something very different. That's something that has to do with encouraging healthy living standards, and that is something that has to do with addressing the fact that 50% of the population in America is now pre-diabetic or diabetic. These are the real problems where prevention has to come in, and prevention is not enough to be seen here. The hospital used to be pretty interested in these things. They offered smoke cessation, weight loss, and stress management programs. That is no longer on the program. The St. John Community Health Newsletter, which I found on the net, is a newsletter about community health, and the last issue which I found comes from 2013. this is a medical industrial complex which does good work when the catastrophe occurs, but which has lost perspective of the community needs in terms of healthy living, well-being, and one of the ways in which that could be remedied would be to do what all the doctors want to do, their patients to be more active, and the way to do that in Santa Monica, a bicycle-friendly city, would be for the hospital to employ 2 or 3 healthy transportation associates who make the step from the doctor's recommendation of more active living onto the bicycle saddle, where people, not everybody can cycle, but those who can cycle, and many are interested to move more and not drive with a car to Culver City, and that is what I'm saying today. The hospital today is almost excluded. There we go.
Thank you, Dr. Khan. Daniel Galamba, and then John Majiri, Sister Maureen Craig, and John Uber. Please.
Yes, I'm Daniel Galamba, and I live on the 1400 block of 23rd Street, right across from the hospital. And I'd like to point out that the situation now is really quite different from what it was in 1994 and even 1998. St. John's was on the verge of going under back in 94, and to keep it solvent, concessions were given to it. Well, St. John's is now healthy, and the area in the meantime has become overdeveloped. The size of the development we're talking about here, almost 800,000 square feet, is larger than that of the Hines project, which was denied 2 years ago. Therefore, I'm suggesting that if the original period of development is to be extended up to 20 years, that the original development agreement should be renegotiated to something that our community can just simply live with more human scale size buildings similar to those of Cottage Hospital in Santa Barbara. And doing so, I think, would really be to the benefit of St. John's, because while UCLA Medical Center is a magnificent institution, it's very impersonal and very non-user friendly. Traffic is currently gridlocked on Santa Monica Boulevard, Cloverfield, and Broadway. And we have a choke point that exists between Santa Monica and Cloverfield, and also between Broadway and Cloverfield. We can't handle the traffic, the congestion, the gridlock that we currently have, let alone that would be created by almost 800,000 square feet of more development. Now in the plan, they talk about adding 2 streets. Okay, that may help, but then they close 21st Street to through traffic, which makes the situation worse. So you add 2 streets, but you lose 1 by closing off 21st Street. We can't leave the completion of the buildings open-ended as St. John wants up to 20 years. The situation can change very quickly, and has from the original development agreement in '98. Therefore, I suggest that the current completion dates of these buildings be retained. We just can't have an open-ended credit card that can go on for 20 years regardless of what happens in the area with additional development that may occur. Thank you very much.
Thank you very much. Mr. Majiri?
Good evening, Commissioners. My name is John Masseri. I'm the Executive Director of OPCC, and for 53 years as a community-based organization started here in Santa Monica, serving our most vulnerable residents, I really appreciate and value strong collaborations and partnerships. So I don't want to repeat much of what has already been underscored around community benefits, but I do want to emphasize a few important points. Obviously, I'm here to speak in support of St. John's Phase 2 development. The community benefits program goes far beyond just cash contributions to local organizations, which of course are important to help us fulfill our mission, but that is really rooted in St. John's values of service, and particularly service to the poor. And the fact that they have leadership at all levels of the organization as well as staff members who are active volunteers in many, many community-based organizations in the community and have been for decades, I think speaks to their commitment to service in this community and service to the poor. Sister Colleen referenced the conference center and education phase of the project, which I can say as a nonprofit that is really grappling with the issue of trying to find space to hold meetings or to hold any kind of educational forum about topics of interest to the community. It's virtually impossible to do that. So that would be an enormous community benefit for the community to make that space available. We're also a neighbor of the hospital. We're 4 blocks from the hospital. And I know in the original development of the hospital, when the North Campus was built, there was a lot of controversy about the issue of parking. And this proposal really addresses that in a very significant way, over and above, significantly above any of the requirements. So to me, that demonstrates a tremendous amount of good faith and goodwill in terms of listening to the community and trying to mitigate the impacts of construction. We are living in a city which is, I know residents and visitors and those of us who work here feel like we're under siege because there has been so much development. But at the end of the day, it has also made this city a place where many, many people want to live and work. So I want to encourage you to support their expansion, understanding that the community benefits program goes far beyond just monetary contributions. Thank you.
Thank you so much. Sister Craig, Roxanne, do you mind helping?
I'm Sister Maureen Craig. I live at St. John's back door. I live on 23rd Street, right behind the hospital. For many years, I lived in the hospital until the earthquake took my place away. But I am here because of someone we in Santa Monica knew very well and loved, Bill Rosenthal. He used to be our patient, and he always would say something very irritating to me when I went in. Good morning, Maureen. What have you done for the city today? Well, usually I saw him at 8:30 in the morning, and my mental response was, I haven't had coffee yet. Don't mess with me, buddy. But it was a question I used to ponder. And preparing for tonight, I thought about, well, what do we do for Santa Monica? I prefer to think of it, what do we do with Santa Monica as a team? And I would say that having brought John Wayne Cancer Institute to this city was a really great thing to do. I deal with patients. I see people from all over the country and many from Europe and Asia who've come to us because of John Wayne. And with the new plan, Phase 2, we will be able to really do a lot more research. And we have one of the most active programs for young fellows in the country. These young cancer researchers are incredible, and we provide them a place to become even more incredible. And then there's the Child Study Center, Child and Family Development Center now. It's the future of Santa Monica, folks. These are the children we see who develop wonderful habits, feel secure, have a safe place, especially those who may be having problems. And with the new Child and Family Development Center, it'll get even better. And I have a third thing. My mind has gone blank. I've been here a long time.
You've done pretty well so far.
Okay, just a minute. The family members saying, if you've ever been in a strange city and had someone in your family get terribly ill, you don't say, I think I'll take a stay at the Ritz-Carlton, that'll be fun. No, you look for a place near the hospital that you can afford where you know they can get hold of you in a minute if you need to get over there. And that's what this patient family housing will do. Give people a place where they can sit down and relax in between those grim vigils. And so I think that if we work with the city and the city works with us, we'll continue what began over 70 years ago. And we're glad.
Thank you so much. John Miller. Okay. Betsy Hitchens, and then Nick Bowles, followed by Andrew Hoyer and Judy Abdo. Please
Thank
go
you.
ahead, Mr. Miller.
Good evening. My name is John Miller. I serve as the Vice President of the St. John's Health Center Foundation. We raise funds on behalf of both the hospital and the John Wayne Cancer Institute. I'd like to address a couple of the fundraising concerns which you asked about earlier on this evening. St. John's was actually founded 74 years ago when 100 members of our community each chipped in $100 apiece to buy the land upon which the hospital now sits. And since that time, St. John's margin of excellence, which has distinguished it not just as an ordinary hospital, but as an extraordinary place of healthcare, has been sustained through the philanthropic support of this community, which has desired not just an ordinary hospital, but an extraordinary place where the best doctors and the finest patient care can take place. Following the closure of the hospital in 1994 as a result of the earthquake, our foundation's board of trustees, which consists today of almost 100 members of our larger community, our trustees led a series of fundraising efforts which raised $350 million in order to construct what is now seen on the North Campus. And if you want to measure how much a strong and vital St. John's means to local residents, I think all you have to do is consider the fact that our community raised over $250 million in order to see that St. John's would be here and be strong. We are finding that as baby boomers age and as lifespans increase, our community's demand for healthcare is growing. And as has been mentioned, the West Side is becoming increasingly congested. People are increasingly concerned about their need to access health care in case of emergency. Frankly put, if you have a stroke, you can die in the ambulance trying to get across the 405 to another place. You need to get to some place quickly so that you're not permanently harmed because of the distance, the time it took to get to someplace other than St. John's. Our trustees have pledged their financial support to complete St. John's master plan, and we, on behalf of them, I would like to encourage you to support staff's recommendation to allow us the additional time to complete our master plan. Thank you.
Thank you. $2 billion is pretty daunting, but it's obviously a task that you're facing. Pretty straightforward. Ms. Hitchens, welcome.
Good evening. I'm Betsy Haichu, a
Haichu.
retired member of the faculty at Santa Monica College in early childhood education. For many years, during my years at the college and subsequently, it's been my privilege to be associated with the people who run the Child and Family Development Center. And as a matter of fact, at the time that the first development agreement was negotiated, my colleague Irene Zevi and I were part of a coalition of people who worked very hard to see that the Child and Family Development Center also included opportunities for the staff at St. John's and for other residents as a community benefit to enjoy childcare. And that service has been a very important community benefit, and I know that the construction of the proposed new center will enable it to do even more than they have been doing. And I just wanted to lend my support and hope for your positives moving forward with the plans for the second part of the St. John's initiative. Thank you.
Thank you so much. Nick Bowles.
I'm supposed to go before him.
Okay.
The chits were handed in that way.
All right.
Give me a
Mr.
moment
Hoyer
to,
and then Mr. Bowles.
install my-
And do you have multimedia for us, Mr. Hoyer?
I do.
Of course.
I'm getting better.
Commissioners, we also have one late chit, Peter Pelican. So, Mr. Pelican, perhaps you can line up after Ms. Abdo. Mr. Hoyer.
Good evening. My name is Andrew Hoyer, and I am the president of Santa Monica Mid-City Neighbors. 1989, 1994, post-earthquake. 2001, one building complete. 2003, 2 buildings done. 2004, we're done, right? 2005, but wait, there's more. 2006, still working. 2007, bigger than before. 2009, wait, what's that smell? Sewage in the street. 2010, yay, complete. Oh wait, 2011, the big dig begins. 2012, now it's a big pile. 2013, almost there. 2014, finally. Bonus round, write off $25 to $40 million in construction costs, except a generous $15 million bonus for naming rights. For 20 years, Santa Monica's mid-city neighborhood has been subjected to the chaos of construction from St. John's, and now they are proposing 25 more. Affordable housing is deed restricted for 55 years, so for starters, how about they provide us with a free shuttle from the 17th Street station every 10 minutes for the next 55 years? Providence has enough weight that they ought to be able to muscle UCLA and SMC into joining them in this venture. Our entire community is suffering from the lack of mental health facilities. Currently, patients have to travel as far away as LA County Hospital in East LA or Harbor UCLA in Torrance for a 72-hour observation hold. This places undue stress on family members who want to be able to easily access and get care for their loved ones going through difficult times. It is time for St. John's to step up to the plate and provide this vital benefit to the community at large that it supposedly serves. You may have heard it said that one cannot limit who gets to live in affordable housing or where they work. This is true if any public money is spent on it. However, if the hospital spends its own money, it can determine who lives there. I propose that after the temporary parking structure on 20th is no longer needed, that they build 1, 2, and 3 bedroom affordable housing at 60% medium income or less in that location for their custodial staff. Did I hear there's 10,000 extra square feet they can use? I've heard that when Providence took over, they were appalled at the fact that the Sisters of Charity did not bother to put in the underground parking we were promised after they had already dug the huge hole in the ground that would be needed. I am pleased to hear that they are working to correct that situation. My members request that they provide large amounts of free parking for the handicapped so they'll stop clogging up our preferential parking. Thank you.
Mr. Hoyer, I have a question.
Yes, sir.
So you come and talk to us quite often about issues. It sounded to me as if you weren't opposing the concept that there would be a hospital and that it might provide new, somewhat expanded services, but you're focused on that they provide community benefits and that the disruption to the neighbourhood be contained. Is that a fair summation?
That's a very fair summation. In fact, my closing statement was going to be, let's have it be 15 years, not 25. You correctly pointed out, or I'm sorry, Commissioner Kennedy pointed out, that the public benefits will only run for about 10 years after they're done. That's ridiculous.
Right. So you're really asking us to look at that disruption and the sequencing and how it impacts your neighbours,
Yes.
your members and neighbours and residents.
And I think a very important part that our neighbors have been impacted severely by parking. Over and over and over again, we've complained about the parking. They park in the neighborhoods, they hang their little handicap placards, and they walk. I've got complaints from as far away as 18th Street of seemingly healthy people putting their handicap placard in as they park in preferential parking, and they walk 4 blocks to the hospital. So clearly there's an issue here. Now, if they were to provide that free shuttle every 10 minutes and anybody coming from anywhere could ride on that shuttle, that would significantly alleviate the traffic that comes into our city.
Thank you very much, Mr. Hoyer.
Thank you.
Nick Bowles. Mr. Bowles, you might want to start.
Hey, how you guys doing? I just want to talk about one big community benefit, something that's been overlooked, and I think this extension is a great opportunity to re-examine it. I live on 21st in between Arizona and Wilshire. I've been to St. John's ER. I've walked there with a separated shoulder. Every one of my roommates has been there, so I'm appreciative of the hospital. The biggest issue that I face, and that a lot of the mid-city neighbors as well as just residents face, is indeed parking. Specifically patient parking. If you think about it as a patient who has a handicap placard, you can park anywhere at any neighborhood at any time. You won't be ticketed for not having a permit. So as a patient who generally goes to St. John's multiple times, you have the decision to pay $20 for parking or just park on the street. So I think 10 out of 10 times, if I have a handicap placard and I'm disabled, I'm going to park on the street and walk a block. It's simple. So my proposal is that there is at least some sort of section within the parking that grants free parking to those who are handicapped or disabled. Free parking for those who have placards, so that they do indeed use the parking that's provided by St. John's instead of residential parking. Yeah, so I think whether it's just a small section or it's all placards, this is really geared at the actual patients, not so much abuses of handicap placards, but people who really do use handicap placards, who are going to treatment or going and seeing loved ones, have some kind of incentive to actually use the parking instead of residential parking, because it is a huge problem and it's hard for me and a lot of my neighbors to just park on our own street.
Thank you. Thank you very much. Dr. Pelican or Judy Abdo? Dr. Pelican, why don't you go next?
Thank you very much. I do have a St. John's. I love St. John's here. It's just not on me. But to quote Abraham Lincoln, 1 year ago, I was here at night speaking in support of building our beautiful hospital. And I'm here again. I haven't gone anywhere. I'm the cath lab director at St. John's Hospital, so I'm going to get down into the weeds a little bit with you. We open arteries that are closed in the middle of a heart attack. We are a participating center in the Los Angeles County Heart Attack Program that brings patients to hospitals with cath labs. We are opening a stroke receiving center so that if you get a clot in your brain and have a stroke, not me, although I'd like to, but one of my colleagues can get the clot out and stop the stroke in its tracks and either minimize or completely terminate the stroke. To maintain that kind of expertise, we need to be able to attract doctors, nurses, technicians to work at this hospital. And when it is a hospital that has a research program, that has a conference center, that has all the things that we're talking about growing and building, it makes it more possible for us to maintain that level of expertise. So the next generation of docs who are coming in will look at this hospital not as a little community hospital, but as a place that is really an attractive place to do cutting-edge procedures and be able to take the best possible care of the patients who are in our community and are being brought to us for emergency care. We're doing that now, and we want to continue to be building and growing, and very happy to be working there. I hope you people will support this program because it's the best for the community here. Thank you.
Doctor, how much time after you have a stroke or a heart attack is optimal before they get to you?
So to participate in let me just answer that for heart attacks since I'm not a neurologist, but we have a 90-minute time limit from the moment you hit the door till your arteries open. So the ambulance takes the patient in, The patient is examined by the emergency room doctor. Our on-call team is mobilized, doctor, nurses, technicians. You're up in the cath lab, you have an angiogram, and the vessel's open. And usually by doing that within 90 minutes, presuming the patient has come right to the hospital when they started having the heart attack, you can salvage or prevent a big heart attack. Similarly with a stroke, we say time is muscle. The more time you wait, the more damage there will be. Taking somebody, I heard somebody talk about shipping someone across the 405. It's impossible to do. So if someone comes to St. John's having a stroke, for example, and we then took the attitude, well, there's a stroke center at Cedars or at UCLA, in traffic, even with the siren on, you will turn either a non-stroke at the end of it or a small stroke into a big devastating stroke.
Thank you.
You're welcome.
Judy Abdo, former Mayor Abdo. Welcome.
Thank you. So in 1994, I was mayor. January of 94, I thought, well, what am I going to do for my last year as mayor? And then there was a massive earthquake. And that's what I did for my last year of being mayor. And one of the things that I was privileged to do was to have a tour of St. John's Hospital shortly after the earthquake happened. I didn't get to go in all of it, of course, but it was devastating. And I'm certainly glad that they were able to rebuild what they did rebuild. And now, as they expand, I think it's going to be really important that we have a facility that is really, hopefully, earthquake-proof. I also went to St. John's to have each of my knees replaced. And I hope it was one of those world-renowned joint replacement people who did it. I think he is, Dr. Yun. Well, I heard a yes. Yes.
One or two? Yes.
Great. Okay. They're working just fine. You can tell them. But really what I want to talk about is the community benefits. For the time that I was the director of child development at the school district, we received funds from St. John's for various activities that we were doing in child development, mostly for infants and toddler-aged children. I hope that as the community benefits package is looked at and deepened, that there will be emphasis on infants and toddlers, because that is the population that is least served, oddly enough, in childcare and center-based programs, and that's where the most need is. And what St. John's has is people with expertise in child development. And during the first 3 years of life is when most brain development happens. Big time. After 3 years, there's a big drop-off in brain development. Now, we all know we went to school and we developed our brains, but that first 3 years is where it's really, really significant and changes the life of the infant as that 3 years goes by. St. John's can help us all by focusing and helping other programs have a very strong child development medical component and brain development component. So I just want to put that in your mind, Jennifer. Thank you very much.
Thank you. That concludes the public comment, and I intend to take a 10-minute break at this stage. When we come back, the developer's representative will comment. Hold on a second. And I also intend to conclude tonight at 11 o'clock or thereabouts. Commissioners might tell Kyle whether they're available if we can't get through the whole proceedings tonight to come back on either May 18 or May 25, just in case that's necessary. So let's have that discussion. I'll see you back here in 10 minutes. Okay, welcome back. So the applicant's team now has 3 minutes to respond to the public comment and then can take questions. Ms. Larmore, are you ready to go?
Yes. Just wanted to respond to a few comments. The first was about the parking being for staff only, and I just wanted to clarify that it's the parking garage on 20th Street that would be primarily for staff, but the parking for patients would be underneath every building, and you'd still have the valet option, but we're envisioning self-park options as well, which would be different and a change from today. With respect to community benefits, I wanted to provide a little bit of history on the community benefits for this DA because they are different from your typical development that you see. The community benefits package was structured in the 1998 development agreement because at that time St. John's was a nonprofit, as it remains today, but there was fear that it would get sold to a for-profit hospital. And there are certain requirements under the state for nonprofit hospitals or health centers, and so those were codified in the city's development agreement. So those that would remain regardless of whether the health center was sold to a for-profit. So I just think if there's the double counting, I think is just a misunderstanding of what those community benefits were. And state law defines the unreimbursed Medicare cost as a community benefit, but St. John's always shows the number with the unreimbursed Medicare cost and then without. And then the additional requirement that the city imposed was breaking it out by what it does for Santa Monica residents and nonprofits. And I have that slide available if anyone wants any more information. I also want to mention that the second phase of development is focused on health and wellness, education, and health promotion. I think that's responsive to one of the speaker's comments. And I wanted to kind of go through the numbers because we're not talking about a 25-year construction period. And I think the number 800,000 square feet is also been blown out of proportion. I think this project is different because you're looking at a master plan. St. John's could come to with respect to the North Campus, piecemeal with the buildings. And you'd see maybe 60,000 square feet or 90,000 square feet. But St. John's has come to you with a master plan, a comprehensive plan, so that you can look at circulation, height, setbacks, siting of uses comprehensively. And so that's where I think it's different from a Hines, especially with respect to the fact that it's a nonprofit health center. But even just thinking about, we're not talking about one building, we're talking about 8 buildings that are phased and being planned so that you can look at them comprehensively rather than piecemeal. I also want to talk about the net development. The chart on the slide shows St. John's proposal, which is above grade, so it's slightly below the 55,000 above grade allowed. And then you net out the existing buildings that are being demolished, 96,500 square feet. And then you also really, when you think about a traffic perspective and impacts, can net out the parking area because parking is an independent generator of traffic. And so that gets you down to a net just for the phase 2 of 450,000 square feet of programmable area. And then when you think about of the program space that you lost in phase 1, you're down to a net of 266,000 square feet. And that's over a 40 to 45 year period. You're talking about 6,000 square feet a year. And so I'm not trying to minimize the fact that there are 8 new buildings proposed, but I'm trying to put it in a little bit of context when you're talking about one of our institutions that it's important to this community and kind of the growth that you're seeing over this long period of time.
So I think your 3 minutes are up, although the little timer hasn't gone. So I'll do the
That's
bing, bing, bing.
fine. Thank you.
So I'm sure commissioners have questions of you now. Commissioner Kennedy?
Just a quick follow-up. Can you repeat what you said about your response regarding the Medicare? Did you say that the development agreement requires the display of both the benefits to Santa Monica residents, but also the unreimbursed Medicare total?
So, again, the community benefits section was developed to codify the states. The hospitals, nonprofit hospitals, have community benefits totally separate from what Santa Monica does. Completely, I wish we had a different word for them. Money that they report.
Yeah. Okay.
And so the development agreement cross-references the requirements under state law for nonprofit hospitals. Because at the time the original development agreement was approved, there was a fear they'd be sold to a for-profit. And the city wanted to make sure that they continued to provide all those services and benefits that nonprofits are required to do by state law.
Okay, I think I understand what you're saying. But are you saying so St. John's wouldn't provide Medicare services that Medicare covers partially if there was no development agreement?
No, it's just about how it's reported out. The state law defines as charity care, community benefits, unreimbursed Medicare costs. So that's included in the number in the state law of how you have to report your benefits.
Okay.
Thanks.
Commissioner Newbold and then Commissioner Anderson.
Could you walk through this 55 years community benefit package? Well, let me walk through, and you tell me if I've got it right. So when the first development agreement was put in place in 1998, there were community benefits negotiated that will go for 55 years.
Right.
When we renegotiate, there'll be new community benefits on top of what's existing that will be triggered for another 55 years?
No, the term of unless this body wanted to amend the DA to extend the term, which I would let the Susan speak to this when city attorney's office, but I know the city already doesn't like having terms that are long. Mm-hmm. They would never do a 55-year term today. Most of your development agreements are 10 years.
So everything ends 55 years from 1998?
It does currently. We could negotiate something differently.
I'm not suggesting that. I'm just trying to understand it. Okay, thank you. Okay, wait, I had one other question, which is, did I miss it? The new streets that are proposed, I didn't see those as community benefits.
You're right. I believe those are community benefits.
And I was just wondering why it wasn't in here.
We will definitely list them next time. They're not requirements.
You really don't have to. It's okay. Commissioner Anderson.
I actually just, I have other questions, but I had a follow-up, which is, I just want to clarify what I hear you saying about the community benefits program that is outlined in the DA was that there wasn't an expectation that additional services above and beyond what is required by the state would be provided. It was just a means of making sure that the state required community benefit level continued if a for-profit bought it.
That was a major piece of it. On top of it, there are several things that are in addition, such as the child's care program and the defining what is specifically going to Santa Monica residents, and there's evaluation for that.
Okay.
Commissioner Anderson, you want to keep answering your questions now?
Yeah, and I'm trying to look and see what is more Paula, because they might be actually more architectural. I guess I'm curious about the open spaces and what the intent of and use of the open spaces are, right? So the site plan includes some areas that kind of look like parks. Is that what they're supposed to be, or are those intended for use?
Publicly accessible open space.
So they'll be designed in a way that they'll function like a public park?
Yes, that's for the community and for everybody to use. They'll be open and you can connect and move around. And the buildings are meant to be very porous and to kind of maximize the open space.
And could you clarify where that happens? Because there's that piece on Broadway.
There's a pointer there.
South Garden.
Yeah. So on Broadway, for instance, that portion of the outdoor space that will connect with the wellness path coming through, connecting here, right through the buildings, across and up into the landscape here and back, across the crosswalks and connecting across. And it's like a string that connects all of the pieces together.
And we also want to have large open space along the kind of sidewalk here, so that there's not only sidewalk, but there's landscape along those edges.
And the piece behind the 10-unit project is not part of the public open space. That's
Yes,
just,
it is.
That's okay.
Yes, it's a buffer. It's part of the public open space. It's part of the community open space. Also, it's not walled off.
Okay.
Yeah.
I guess too, can you maybe just talk about the experience of someone driving and parking and walking, and how does someone get to the site, and then once they've parked, can you just kind of give us a little bit about how that experience?
Yeah, and one of the reasons to introduce the 2 streets was this area doesn't have any real open space, and the way to do it was to say, let's put in 2 streets, and the two streets then really serve all the needs of driving, but they open up the middle, they protect the middle in a way, and they make the middle of the site much more accessible for everybody. And that's the kind of strategy. Right now we've got the road coming down the middle, which brings the cars right through it and makes it very fast. We vacate that portion here so that we have a plaza here. So right now, if you're coming along Santa Monica Boulevard, it's a very tight street here. There's very little sidewalk here. And then we want to open it up, pull the buildings back, and almost suggest how you can slip in here. We see the plaza here very activated. All kinds of uses, whether it's structured or informal, and uses around the ground floor. The ground is so important. I think if you're not using the hospital and you're in this area, that sitting here and inhabiting, my feeling is that the space has to be useful. It cannot just be open space. Be useful, it means that when you go there, you do things, you sit there, you relax, you meet people, but it has activities that support urban life. And we see that plaza there as a real connection. Now, we know that the existing Mullen Plaza isn't working well. We've been trying various things. We had some food trucks there one day, and it was amazing actually. It brought tons of people. So as part of the master plan, we're looking at all of those, how spaces can work better. And then
so Commissioner Anson did ask you about if a person drove a car.
Yes, so if you were driving a car here, you can take this street here. There's below parking in this area here, which can be dropped off here. You can walk in from here. On the opposite side, depending on which building you're going to, whether it's the John Wayne or the Eastern Ambulatory Building, you can also come in here. We've parking below this building here. The parking does connect underneath the street in the proposed plan. We will also have parking in this building, where you'll come across here and be dropped into their parking below this, or parking below this building. Right now we have one drop-off, but in the future we'll have many, many drop-offs.
Why are the parking lot? Why do you need a tunnel to connect to the parking structures from across Santa Monica Boulevard?
Underneath the street?
Yeah.
Yeah, we don't need it, but having a connection there would actually even help, because the parking then isn't just in one area. It can flow. You have options then, and easy access. We have only been looking this, in the very early stages. We certainly couldn't put it at the first level below ground. We'd have to go down at least another level because of all the utilities. But it's like the street itself. You want more options, more ways of circulation, more ways of coming in. So if you come in on one side, you could leave at another portion.
Yeah, I guess that's certainly beneficial in terms of traffic flow.
Yeah, it's like the streets, opening up the arteries, opening up many different ways of getting out.
What about, it was interesting to hear that about the 10% versus 90% on the Child and Family Development Center, because I know that I was thinking that was, even though I had heard about all the various programs that were being provided, I had really been thinking about that as a childcare center, but it sounds like it's a lot of office space
Square
or
footage
meeting
wise.
space and a childcare center.
Not office necessarily. So I also think, and Lindsay, maybe you can come up here as well. The Child and Family Development Center has also a therapeutic preschool. So that's not governed by the 49 spaces of just plain vanilla child care. But so there's the preschool component of the Child and Family Development Center. And then there's the outpatient mental health services clinic space. Square footage wise, it is heavier weighted towards the mental health component than the daycare component.
What did Lindsay want to say something?
Just to add, some of the spaces, the interior of the spaces are for large group therapy programs, especially for adults with developmental disabilities. There are double rooms where a family can have a session while therapists and others observe the group dynamics before proceeding with family therapy. So there are lots of specialty styled therapy classrooms in that building where it's not just office space. It's not just like a desk with a clinician and a chair for somebody to sit in.
And there are actually two distinct permitted uses in the development agreement. Child and Family Developments is a separate and distinct use from daycare, although we don't call it daycare today, but that's the use in the DA.
Yeah. And for the daycare, what is the thinking about drop off? Because obviously,
so there is proposed loading on the site on that new street, but there's also easy access underground. Do you want to get into more specifics? I can ask someone else.
No,
employees, right, would have several options if they wanted to.
But it's not just employees at that daycare center.
It is
right?
not. So there's three priorities. It's employees of St. John's, and then residents of the city, and then employees that work in the city. Right now it's 50-50 about St. John's employees and community families and Santa Monica employees.
You might just want to think or rethink about how realistic it is that a parent's going to go downstairs and park and drop off. I guess I would have concerns about the character and quality of those new streets because when you kind of think about the campus and the focus on the campus and that, as James described, right, that there's this nice ability for a pedestrian to move around because there aren't streets. It makes those streets feel like the backside of this campus, right? So we'll want to make sure that those streets are designed in such a way that people don't feel like they're on the backside of a huge institution, both in terms of the way the street is designed and the streetscape is designed and the buildings are designed, right? It's like you're going to have to design buildings that are, 360, have 360 degree designs. I think that I'm seeing like the one last question that I have, I think, is just about the parking structure. I have to be honest, I like the fact that St. John's parking is distributed all over the city. I guess that's perhaps a pain for St. John's, but it distributes traffic, it puts people on the street. Is there a reason for that huge parking structure being there on 20th Street aside from the phasing, right? Like, would that parking or could that parking be provided in a different way if it wasn't for the need to get spaces built before something else is built?
No, I think the issue really is that if you look at the phase 2 sites, they're all the surface parking lots that serve the existing hospital facility. And so the only way to avoid the parking structure above grade at 20th Street is if we could find a place to build subterranean parking somewhere else. But we would also love to have program space there. It's just, in order to develop this, if you look at the east piece where the John Wayne is and all that parking, in order to build that, you're taking off almost 400 spaces offline.
So it is a sequencing issue more than anything else.
Well, I mean, if we did it all at once, it doesn't help us. There's no other sequence. I guess, you know, like you have to keep Child and Family Development Center operational. You have to just keep John Wayne operational. We have looked at it 500 different ways. Yep. Because there's lots of pressure to try to get more program space
Commissioner
over there.
Barry has a follow-up.
I just want to get confirmation that that includes the sites on the North Campus.
What includes?
Well, that the what are they called? The 2D and E and 2C. That there isn't potential there to go down. Take the surface spots offline and go down to build subterranean parking there instead of on 20th Street.
So yeah, you're right. I mean, the John Wayne, if we could, if everything came together, we could build a John Wayne on the North Campus early, right? That it doesn't fit, the floor plates don't work. Those sites are so narrow. And so the need that's driving the urgency is replacing the John Wayne campus facility. And we cannot replace it on the North Campus and build subterranean there because the footprints of the sites are too small.
I actually think that was a different question. I think the question was, in the ambulatory care and the other building, why don't you just dig the underground parking there straight off the bat? There are no buildings on that site, and then you could proceed with the John Wayne simultaneously.
The two spots that are currently surface parking also?
Yeah.
Because they're the surface parking lot that are directly adjacent to the front door and serve the hospital. They take off surface parking as well. I guess I'm not really following the question.
I'm raising the idea that is there a way that the parking could be juggled where St. John's is building that subterranean parking on the North Campus on those two sites or one of those sites instead of building it on 20th Street. So
you have a big parking structure right there?
Or a deeper
it'd be subterranean.
Let me answer this. Those sites, Jason, are very small, and once you start putting in the ramps, they become really inefficient. So you're starting to dig. You'd be going down 10 floors to get enough parking in there, or way down. And because the C site and the D site are separated, you end up putting in ramps on both sides and going way down. So you'd be just chasing yourself trying to get parking in there.
Right. Now, where was the... Can you remind us where the parking... If Commissioner Anderson is okay if I pursue this line.
She is. She signaled to me, yes.
So where was the parking going to be provided that the 2011 amendment allowed flexibility on how the parking...
Underneath the entry plaza, right here. Sorry, you can't see, but...
So as much as you'd hate to lose the entry plaza, does that have potential across those three sites?
We've looked at it. We've studied this a lot. Because of the structure that went in for the hospital and then the entry plaza, it's a huge... I don't think it would be feasible. We've looked at it backwards and forwards. In addition, when you think about impacts, you're thinking of tearing up the whole front of the hospital again, having your main entry for the hospital again be for another 20 years over there in that corner, crammed into that lot. We've studied it.
Right. Now, and what's driving my question is both the location and just the general concept of having above grade parking along 20th Street seems problematic in terms of how it would serve the rest of the campus and also just above grade parking.
Sure. And we have studied it. Our traffic engineer has preliminary studied it, and we'll be working with staff on that. That's why it's primarily targeted for employees, because they know where to park and they know how to get to their facilities rather than patients. I hear you on the above grade structure. I will just say, just as a frame of reference, that St. John's is coming to you all with this plan, and I think it's a great opportunity for the community that the Planning Commission and Council reviews it. Other institutions of this size have much more above grade parking, and they never have to come to the city. So they are investing a lot of resources in building subterranean parking, and no one wants to be spending the money on above grade parking, but we do feel it's a necessity for the plan.
Yeah, a lot of those institutions, when they do that, I just grit my teeth
I
and
know.
grind a little bit. And yes, Commissioner Anderson, thank you for obliging.
I guess I think I'm done with my questions, but I guess I want to ask the chair a process question because I do need to leave at 11. I don't know if I should take another 5 minutes and share my thoughts, or do you think we're really going to come back another night? Or
I'm going to ask the Commission, but I do believe that when we go past 11 o'clock, it's not very productive. People's comments get longer, there's more discussion, and I think there's at least another half an hour of questions. I really don't want to rush questions. I'd also prefer to have deliberation in prime time when it comes to that. This is such an important development agreement. Whenever we come back, I think it's important that people who are at home can watch it. So that's my thinking, that we'll have at least another half an hour of questions, and then we will come back. It's probably a good time. Do other commissioners share my view on that? Please, Commissioner Kennedy. We'll just spend 2 minutes on this process and then make that decision. Go on.
Well, since you asked, I did have a process question and comment. Because I'd like to get just a little bit of clarification about what is really before us and what we're doing this evening. So, and please correct me if I'm wrong. So I think this evening, at least what's been put to us in the staff report, and from what I understand listening from the applicant and staff, is there are two issues. The first issue is for us to simply amend the development agreement that the staff currently has in place, which is for north and south development. South needs a master plan and only Planning Commission approval and council extension. The north doesn't need a master plan but needs a DA amendment. Now, based on the questions that we just had a moment ago, which would essentially could potentially have been an amendment to the north, to the development agreement for the north plan, and the applicant has already said they weren't interested in that. And based on the fact that there appears to be no transportation demand management currently existing in the current development agreement, and I'm wondering, well, I actually didn't get a chance to ask it, but my question is shouldn't we be perhaps deciding whether or not we think as a commission, just make comments on whether or not we think we should be amending the development agreement as proposed by the applicant, or if we should be looking more closely at what staff is proposing, and after we come to that conclusion, have more of a discussion with the applicant? Or at that point, is it over, and that's when council will decide to have a float up? I'm just a little bit confused.
Jean.
Right, and I think we, what this is, it's a proposed amendment to the development agreement. So, it's not technically a float up in the traditional sense because it's not a new, development agreement. What's being asked tonight is that the Planning Commission provide your recommendation, your feedback on the 4 items that are listed in the recommended action part of the staff report, if that's helpful in focusing the discussion. What's really before you tonight is provide preliminary feedback, and these would be recommendations to City Council, because this will also go forward to the City Council for the same kind of preliminary discussion on the extension of time to complete the phase construction. And you see number 2 here, the applicant's request for extension of time to complete the phase 2 project, and then the procedural change that Roxanne outlined in her presentation. That's really looking to provide a process to review the master plan, the development review permits, and in the context of the development agreement. and then feedback regarding potential community benefits. So it's really those 4 items.
So in essence, you're looking for, at the end of our discussion, a recommendation to
Right.
pass to the City Council about potential directions to go in.
That's correct, right? But what you're not, the commission does not have to take a vote in the formal sense. You can allow your comments to stand on their own.
Right.
You know, you don't have to come to a complete consensus on those comments.
However, it's a pretty complex development agreement and new directions that are in front of us. So there may be quite a lot of discussion people wish to have. I do not know at this stage. Commissioner Kennedy, and then let's try and move on.
Thanks. It's just my last comment and follow-up is if, first of all, the staff report doesn't specifically say that the council will be making a recommendation to the city council, so I understand that we can, or we don't have to, or can take any form that we want in light of the fact that it's a proposed development agreement amendment. I get that. But why then was the staff report put to us that while you may have these 4 recommended actions that require us to just provide the staff with some feedback, I want to draw out of you your why you put to us in the staff report the intensity of the decision between one of the 2 items, either the staff proposed alternative or the applicant's proposed development agreement amendment.
I'll go ahead and speak to that. I think the statement that there's an intensity being stated in the staff report between the applicant's proposal and the staff alternative, I guess I'm not sure what you mean by intensity, but I will say that we laid it out there because the applicant filed an amendment request. We are taking that forward for discussion and recommendation from this body and also from council on how to proceed. In reviewing the applicant's proposal and in trying to think about securing benefits and protecting process and getting to a great end product, we thought that the process was flawed. That's partially based on just the construct of the development agreement and where we stand in time today in 2016 relative to the Phase 2 vesting deadline. And they've submitted a proposal that we think there may be another process, a better way. It's outlined as a point of discussion, as an alternative that we as a staff would like to explore. I'm not sure that we had initially intended to put the framework out there, but it's important, and we think that it's better to get feedback from everyone, including the community, on whether an alternative framework for review and approval makes sense. The applicant's proposal was filed by them. We're responding in part to that.
So,
thank you.
I know Commissioner Fresco has a number of questions, and others have questions. We can keep doing that. Commissioner Anderson, if you want to leave some comments, you can, but my belief is it would be better if we asked the questions, got to a point, and then had the discussion and deliberation that the Commission seems to want on the next night. Because I think that will be more effectively, it'll allow people to ask the questions they want to ask at the length they want, and then we'll have time to think about it and review it and make the determination. So that's the way I'll be proceeding. Commissioner Fresco, you're next up.
I have some questions in the development.
And just before you do that, Commissioner Anderson, I know you're on a time zone, so if you have to go, you have to go. Thank you.
And I will.
Commissioner Fresco, we're going to try to.
Community benefits in the TDM, actually, it talks about having a carpool coordinator person. And I was just wondering more about that. I know that in other TDMs, that person had a very, in a recent one we did, that person had a very active role in the community on where it was placed, and the kind of community building around a transportation culture sounds really good to me, and the way it's described in the DA is very vague, and I'm wondering, what that position does and if we need to maybe strengthen the language to just clarify the culture of transportation we're trying to create there.
Okay, so 2 points in response. The first is that the development agreement was amended in 2011, And in that process, Exhibit M to that amendment is a very detailed, not only the requirements for parking management plan, but also a transportation demand management program with specific implementation measures. We monitor that actively with Providence. And the role of the transportation coordinator has grown over the years since 2011. The culture of mobility and alternative modes, we work with them closely on that. They do, I just want to make sure it's clear that they do have TDM program requirements, and that was instituted in 2011. We review them, well, year-round with them, and I'm sure they could speak. I talk to them all the time about their TDM program. They go through annual enhancements to their program. We absolutely intend to strengthen that program in significant ways through this upcoming process.
Kind of answered my question.
Well,
yeah, I mean, I understand. I read the agreement and the program and the report from January too. So I got that. I was just really wondering about that particular position. If all they do is they have some other job and they just arrange a few carpools, or is it you?
No, but she can speak to it.
Yeah, I can speak to it. We have a dedicated employee transportation coordinator. That's her only job, is to advocate at new employee orientations about signing up for alternative transportation. She just coordinated and hosted with Big Blue Bus and Metro events for our staff to enroll in the Expo line to get a free TAP card. So that's her primary job. She coordinates carpools. She implemented 100% subsidized van pool for all of our employees. So we're active in this process, and she's been spearheading all those efforts.
So you have vans that go out to far-lying areas to pick up employees?
We work with
them?
V-Ride to do that service, but the van, the service, the gas, all subsidized. And
Okay.
the employees also receive our daily incentive for using alternative transportation.
Beautiful. Thank you.
Thank you.
So this I think I understand now. So about guest housing for the patients' families, it sounds like programs are being enhanced. The cancer center is being enhanced, and there will be lots of scholars as well as families coming. Are we sure 30 units is enough? And I just wonder how you got to that number. Is that a minimum? Is that what you've analyzed is the right amount? Because, it does provide a benefit to the community, even in terms of traffic reduction, besides what it does for those people. So I'm just wondering about that number 30 when the DA says it could go up to 100.
I think it's just all of a balance, because there's a limited amount of vested rights, and then St. John's has a limited amount of land, and then this land in the city is one of the only places you can do medical uses, whereas the more hotelish or short-term stays could go somewhere else. But the range was always studied between like 30 and 40 units, and also there was a sensitivity to trying to putting more height along Broadway. So we could study that further as we go through with the environmental review and alternatives, but 30 to 40 units was what was always studied.
Speaking of Broadway, and speaking of parking structures.
Commissioner Fresco, is that a follow-up? No, it's not. I do have a follow-up to that. What level of housing is that? Is it a 3-star hotel level, or how would you describe? No, how would you describe it?
The level has been described. They are designed with, most of them do not have any kitchens. They're rooms, and they vary in size from smaller units to more kind of family-sized units.
University
with
college
kitchenettes.
style. I'm seeking some guidance here. Okay. Commissioner Fresco.
So I had two other little points. One of them is kind of more for you guys, but maybe for you guys too. I'm not sure how it affects the DA, but this idea of sheathing the above ground parking structure in that housing, which might involve a little more height and changing some things to allow us to have a more usable and exciting open space by Broadway, and making that parking structure not quite such a dreadful sore thumb on that 20th Street frontage. So that's something that
Talking about putting those units that you were just talking about around the parking structure?
or on top of it or in front of it, or and I don't know if it fits, but it's just a thought I was having, because I really want to make the open space useful. So I don't know if there's something that you have to say about that thought, but that's something that we should bandy about as well. But if you have anything to contribute.
I don't think we want to say anything at this point. I think
but,
we
okay.
welcome those kind of ideas and alternatives as
Right.
we're exploring.
Okay. And then the last thing is, we've heard a lot about really great programs that happen at St. John's, and about really amazing world-class specialties that occur there. But we've also heard from community members that there's a need for a different specialty, this whole mental health thread that we have heard a lot about. And I understand that there were studies about community need, and I also understand that, do we want to ask the Gap to suddenly jump into the wedding dress business? Or, it's like, how does that desire of the community fit into this? And, how can we try to satisfy that need without, do you see what I mean? Is that, help me with this.
I'm probably not going to help you. I will say we've heard the comment and we will listen. We're here to listen tonight because it's a preliminary feedback. I don't think there's a desire to have our program and our services dictated for the next 20-some years. But we heard it, and we do feel that we do a lot in the mental health area through the Child and Family Development Centers, particularly focus on the children and the families.
Okay. That's something. And then in your child care center that you're proposing, I think I saw some numbers, and I did a quick calculation on my calculator, and it looked like it was like 60% employees, 40% locals. Is that right? And if so, is that going to be mirrored in the new incarnation of it, so that it will have to obviously accommodate more employees, but will it proportionally accommodate more residents?
So right now under the DA, there's 49 required spaces, and the priority is first to St. John's employees, second to residents, and third to people that are employees in Santa Monica. So we haven't proposed to change that priority. However, in doing the child care demand study, we've assumed keeping the same number of community spaces we have today, which is they're about 50-50, St. John's employees and community spaces. So we're just kind of holding that constant. And so the projected increase is to about 73 spaces. And we have a draft study, and city staff has provided comments, and we need to go back and look at those comments. So it's an iterative process, and ultimately you'll have to review it and the council has to approve it.
Okay.
Does that answer?
Kind of. It's close. And then my last question was also in the TDM. I noticed that there were 90 bike parking spots, which seems extremely scant. We get that for one building, and this is 8 buildings. And is that something that is just based on the 2011 bicycle climate, or is...
It was everything that was filed with the DRPs, and with respect to the bike parking, loading, other things, they're based on the code that was in effect when we filed the development review permits. But we understand the world has shifted, and we need to look at the bicycle parking. Right now it's proposed to be dispersed throughout the campus. We think that's a good thing, but we think quantity needs to be studied further.
I think so too.
Okay.
Okay, so
Okay.
that was the last question. Commissioner Newbold.
I guess I still have a process question. I came tonight prepared to give very general comments about the master plan and to talk about whether we think the city's idea of the amendment is better or worse than the applicants. These kind of detailed questions, we will have another opportunity once we figure out what the plan is. And I just want to say this so that make sure that we all understand it, including myself, because I feel like we're now planning to have a second meeting, but I feel like a lot of these things we're going to ask again because a lot of things haven't been worked out yet. Is that
Roxanne.
true? And when will we see this again? After we've given all of our general comments and you've gotten comments from City Council, and then there's some reworking done, and then you come back to us, correct?
The fall, I think, was your timetable, wasn't it?
And that will be before the EIR is started?
So what's being proposed in the staff procedural amendments is that we will bring back procedural amendments to essentially correct the process that is existing in the DA right now regarding the review of the master plan, because it's really, when staff looked at it, we considered it a quasi-legislative plan that or action that's being taken. So we thought the appropriate review body was the City Council. The Planning Commission, however, would be providing recommendations to the Council on that master plan that would come back to the Planning Commission after the EIR is completed. And then then that would be brought forward with the DA amendments, based on the feedback that is provided by the Planning Commission and the City Council in these early preliminary discussions.
So if this idea of like moving the housing around, we won't see it again until you've already, I guess the EIR is only going to be looking at the square footage and the vesting right. Those decisions have to be sort of decided.
Right. The EIR, the purpose of the EIR really is to study, a certain amount of development. There can be alternatives that are looked at in the EIR, but in terms of, how much housing there might be or what have you, those are still issues of policy that, the EIR is not going to direct. Okay. It will just simply study the outer parameters, and whatever the Commission or the Council wants to do within that is, open to policy discussion.
Because I'm ready to make comments about
just one second. So
things.
let me ask the question.
So
the real issue on the EIR is whether we're recommending this hospital get smaller going forward in the DA.
Right. What we do often do in EIRs is we study sort of the outer parameter, and then we look at different iterations and alternatives of that to provide as many options to decision makers as possible. You'd probably study the outer parameters of what's being recommended anyway, wouldn't you? Which would enable
Correct.
us, if we decided, to shrink some of the buildings in
That's
the future.
right.
Okay.
So can I ask, since Commissioner Anderson has to leave, I would like to give my comments tonight in hopes that we cannot meet again.
Well, if everyone doesn't
Then
have
maybe
more
Commissioner
questions, yes,
Anderson-
we can move along. I'd be happy to do that. Commissioner Parry, do you have questions? No?
Well, I guess I do. I just wanted, I assume that staff also has concerns about the above grade parking on 20th Street.
We do.
Okay, thanks.
Okay. So,
Do you have any ideas for solutions?
Well, we have spent a lot of time looking at circulation. Like I said before, circulation and parking provides a framework and a spine for this project, so we have spent some time. We have not ruled out the location of the parking being along 20th Street, but we are looking at very carefully at how it functions, how it might function, how much space, how many spaces might be a better fit there. We're looking at how cars will move in and out and around that structure, and to see if it's really a viable location. We understand the need for it with respect to phasing and with respect to parking in general. That's a community issue. The structure is coming up fairly early in the process and allows other things to transpire. But we are looking very carefully. We do have some solutions, some ideas on how we might mitigate some of the challenges with getting in and around that structure. We have not presented those yet because we're trying to get a handle on the phasing and the time period and the extension request.
So, Commissioners, if we're out of questions, we can move to a recommendation, and we will take from Commissioner Anderson her thoughts before she leaves, and we can work along, and that would solve this issue, knowing that it's going to come back to us in greater detail in, I guess, the fall, and that the EIR will probably study the outer parameters of what we're talking about.
I think I want to be clear that what would come back in the fall, and if, based on direction tonight and also from council, is really this number 3 on the list about the procedural change.
Sure.
So it would be a very limited scope. We would not
Abs-
bring back the whole thing because obviously the environmental analysis would still be ongoing.
No, I understand that, assuming we go in that direction. So if that's all right, Commissioner Anderson, why don't you give us your thoughts? Turn the microphone on.
I'm comfortable with the procedural change that staff is recommending, and I like the staff alternative that's been proposed with regard to the timing and extension of the DA. I think there's been other projects that we've worked on that were large-scale projects where we kind of looked at the multiple building large-scale project as one project and never really had the opportunity to look at individual buildings. So I think I guess that would happen in either one of those alternatives, whether it's the applicant's idea or our idea. But it does seem wacky crazy to approve a DRP for a project that's not going to be built for potentially 20 years. So if I'm understanding staff's proposal correctly, that we'd approve a master plan and a handful of DRPs, and then some of the further out projects would come back to us at some future point in time. But obviously, I think, sorting out, I think what Commissioner Newbold brought out, when the open spaces get built and things like that, when those streets get built, when the new entry plaza gets redesigned, that'll be a challenge for staff to sort through. But obviously, those benefits are really important. In terms of the master plan, a couple of comments that I would share are the buildings in the renderings feel pretty massive. So it would be great to think about a way to maintain their efficiency, but also break them down so that they are a little less so that they're less imposing. I think the other thing that's making them imposing is that the architecture, and I realize that this is a master plan, but because the building designs of all the buildings seem very similar, that makes it more imposing. I think it would, to enhance this idea of like reinserting the grid and making it feel more like a city street, we would want to see different architecture for the different buildings instead of kind of one, to make it feel a little less institutional. So variation in the building designs and styles. I don't want to say styles, designs. Commissioner Fresco brought this up. I think it'll be really important to think about ensuring that there are active pedestrian uses along Santa Monica Boulevard. I don't necessarily feel like that should be a request. It should be a requirement so that we can maintain activity on those streets. I suppose less so on the south side, but certainly if those buildings on the north side are going to get built right along Santa Monica Boulevard, we want to see some kind of active uses there. I guess a small thing, but I feel like it'll be nice to create pedestrian connections between the North Campus and the South Campus. And my sense right now, it is hard for a pedestrian to move from that new building on the North Campus out across a plaza. So just thinking about how to make it easier for pedestrians to move from the new building on the North Campus to the South Campus as that entry plaza gets redesigned. The bridge across Santa Monica Boulevard, it's hard for me to say whether I would be okay with that because I feel like it's all about the way it's going to get designed. Thank you for being patient. Community benefits. I really like Commissioner Fresco's idea about affordable housing, exploring the opportunity to build affordable housing on that site where the 10 units are. And I guess I would go further to say that, or I would encourage the applicant to propose more units or assume more units at that site in the EIR than just the 10. Obviously, the 10 is a minimum requirement, but let's add a couple more floors and build some more housing there. This is a really unique opportunity. High level of LEED, I think, is really important, mostly because in so many ways, LEED and sustainability is about health. So I think it would be a great reflection of the hospital's mission and goals to achieve a high LEED standard. I'd like to say platinum, but I know the standards are changing a little bit. So, and I know Commissioner McKinnon will say platinum, so that's okay. And then enhancement of the TDMs. I don't know why. I don't. What are you reading that you know what the TDMs are? And it's, in conversations with the applicant, there's an incredibly robust TDM program that's already being implemented, but obviously the incredible number of trips that are going to be generated for this project, it's just, a really super strong TDM program is super important for this project. I think that's all I have.
Thank you, Commissioner Anderson. Commissioner Parry next, and then I'll come back to Commissioner Fresco.
Yeah, on the question of process, I think the more incremental approach that staff is putting forward is the way to go. I understand that there need to be assurances about what will happen in the future, but trying to make it work where there's as much incrementalism as possible is a good idea. Changing the master plan review process to treat it more like a specific plan or area plan, that makes sense to me, where council is having the final review of the plan. I would really suggest that in some form or another that there is a stronger housing component to the whole project, consistent with previous comments. Exactly where and how, I don't know, but I'd want the EIR to include the larger housing component so that the city has the option to pursue that within the scope of the EIR. As I indicated earlier, I have great concerns about the above grade parking structure on 20th Street. And I look at that site as the potential for housing, specifically, perhaps staff housing for the health center. It seems like there's just a lot going for that general idea, reducing trips into the area by bringing employees into the area. With the, if it's the case that the parking structure that city relieved the applicant from having to build as part of the 2011 amendment, I'd find it pretty frustrating if we are looking at this phasing conundrum where we're being told the only workable option is to put above grade parking over on that 20th Street site. If that's a result of not having built that underground parking over at in front of the main entrance some time ago, I would find that pretty frustrating because when this, I don't remember it coming up as a factor in our considerations in 2011. And so if it is the case that having that parking there today or at some point in the future would remove the need to do above grade parking on 20th Street, I would say we need to pursue that. In terms of community benefits, I think it's the approach that's been taken thus far, where we're trying to get the community benefits within the institution's wheelhouse and the services that they're all already providing. That's a great approach, and I just want to underscore the idea that was raised in public testimony that we really kind of carve out and prioritize services to infants and toddlers.
Commissioner Newbold.
I guess I would say I also have no problem with changing the procedure that City Council is the final word of the master plan. And I also like the city's idea for the amendment as opposed to the applicants. I think the phasing needs to take into account, Commissioner Anderson kind of listed everything, the open space, the new streets, the circulation, and also Roxanne talked about the parking, reevaluating the parking kind of at each stage. I think we need to continue to look at that. I look through the lens of St. John's being generally a really good thing to have in this city. They have very good jobs. Lots of my friends and neighbors work for St. John's, and lots of people that I know go to St. John's for healthcare. So I see it as a great thing to have here. And I do recognize that it can negatively impact the neighborhood with traffic. And so when I look at community benefits, I think about, and again, this I think was mentioned, doubling down on the TDMs, re-looking at that 2011 amendment and seeing what more have we learned, what more can we do. There was something that I didn't quite understand, and you don't have to answer it now, but about the shuttle, and it was paid for 15 months. And then it seemed to go away. So looking at, that wasn't clear to me, but looking at that bus service and seeing how we can continue that. The affordable housing, I think, is a great idea. And then looking at, and you touched on it too, the community health needs. What else is, what other needs do we have? I know that there is, at the schools, mental health help. I just learned that this year, and it's a really valuable asset at Lincoln Middle School. And I'm assuming that will be part of the conversation. Is there something else needed in the school district? And then I guess the other really important thing to me is this open space and getting really high quality open space, because I don't think it's where it needs to be right now. And I think this is a rare opportunity for open space in this neighborhood that has very little open space. I'm a little concerned. I look at the walking path idea and it sounds really nice, but I think there's kind of this walking path already on the north side and there's never anyone on it and it doesn't work. It's nice to have a little green space to rest your eyes, but we need something much more useful for the neighborhood. And I look at those little pockets of open space down on the south side and I think, isn't there some way to rejigger things so that maybe you can get a little more space? I question that area along Broadway that looks like it's 50 feet wide. That's just, I don't know what anyone's going to do there. And so I think that just, to me, that's the most important piece of this. Have I answered all of the questions? I think that's it.
We can come back. Commissioner Fresco.
In terms of TDMs, one of the things I think that we do things even more stringently now than we did in 2011. And it looks like from the report that apparently I'm the only one who read, but somebody told me to read it, so I did. It says that the AVR is 1.5 right now, and they're pretty close to that, so I would certainly encourage them to...
Not that close.
It was like 1.4.
Actually, 1.34 AVR in the AM, 1.36 in the PM, 1.8.
Well, we want to
It's a distance. It's a distance.
It's okay. Let's stretch it. And bikes, we need more bikes than what's there now. in terms of one of the things that was a priority for me was getting the roadway circulation thing with the new roads and the routes and the loop to kind of front load that a little more, if at all possible. I think that that is something that's going to help everything, kind of grease the wheels of a lot of things in the neighborhood and keep things moving. And I would like to not have to wait until year 10 to get that all finished. I hate a bridge over Santa Monica Boulevard under any circumstances. Sorry. I would rather consolidate the phases, which doesn't mean necessarily squeezing them together, but just have fewer periods of construction for the neighborhood, if that's at all possible, and with nice, sturdy conditions for construction management for the neighbors to keep the streets flowing and the piles of dirt under control. I also had a note about making sure the hospital isn't turning its back to the neighborhood, that it has a real 360-degree feeling, and that the scale of it just goes down as it goes to the south, as your plan shows, but also not to make sure that it isn't all inward facing. I also would like to see, car share wasn't a big trend in 2011, but we have home visits and school visits and all of those things, and we need car shares so that people won't feel they have to bring their car in because they're going to have to do some home visits during the workday. Highest level lead sustainability, obviously. That's just, I think every building needs to do that today. It's really important. I asked this question, but my note was to ensure that this transportation coordinator was really a community building kind of a job and not just somebody who tries to organize people from different zip codes on their computer. Make sure the circulation doesn't thrust Broadway traffic onto Broadway. I feel like Broadway is very impacted by the loss of the free flow on Colorado already. I think the bridge, and I think there was like a little indication in the plan of some alternate pavement over Santa Monica Boulevard, which makes it feel more private, and people will say, oh, we're entering somewhere, I don't know if I can get through, I better turn. I want to make sure that it continues to feel like a street that has a really safe, good crosswalk, but it's still a city street that belongs to our regular grid. Would really love to see about partnering with the affordable senior housing that's already in the middle of your campus. I had a little crazy dream, which I know can never be, of even putting some of that housing with them and providing their parking as an exchange and getting more park space. I don't see that one happening, but I always have to throw it out there.
Be hopeful, Commissioner.
I'm a very optimistic person, and I would really, really like to see the open space enhanced. Both of my suggestions about rejiggering things have to do with making that a really great park that, I think people really want a park where, they take their kids, a playground, and a park where they can just go. I think over-designed parks is kind of a problem for us now, that people are hungering for just open space that stresses the open. No berms, no walls, no ridges, just open space, maybe a little shade. I really agree that all of the housing being 100% affordable senior housing would be really terrific. And hey, if you can get more in, that would be even more terrific. And I believe, we heard a lot of notes about wellness. It sounds like most of the community benefits that people asked for were definitely in your, what did you say? In your wheelhouse. And I think that is really important. I think that it sounds like you kind of already provide a lot of the things that people are asking for, except maybe that more intensive mental health care that has come up. So that's something to think about.
Thank you, Commissioner. Commissioner Newbold.
I had two other quick things. Those streets should be complete streets so that they have, for all modes of transportation, and they should, be slow traffic and lovely. And then I guess I just wanted to say about the parking structure, I guess I'm a little bit less uncomfortable than some of my colleagues. I'm not sure why, maybe because I'm used to going into the above grade structure right behind that building, so I kind of have that in my head. But that particular street is not very pedestrian friendly as it is, and so even if there was parking with some kind of retail along there, I think it would be an improvement over what's there now, which is, I guess, sort of the child care center, but it's just windows and doesn't feel pedestrian friendly.
So Commissioner Fresco had another thought.
Sorry, another piece of paper I shoved to the side by mistake. Again, I just wanted to reiterate what I mentioned in the beginning when I'd asked that question about the bank, to make sure that the DA provides the opportunity for enough retail that we might want to delineate when the master plan idea comes to us. Oh, yeah, and in terms of the procedural things, which I didn't mention, I agree with my colleagues about the staff recommendation, just ensuring that our fine-toothed comb level of attention gets to continue to occur when it's at our level. Guest housing combined with the parking structure, I mentioned that idea already. And the importance of the retail frontage in the courtyard in particular. And those were my other notes.
Commissioner Kennedy.
Regarding the staff's question number 1, the feedback on the applicant's request to allow the extension, I'm not in favor of that the way the applicant has proposed it, based on the information we've been presented. 2, I might come back to this one at the end to provide feedback on the proposed South Campus as it relates to the request for an extension of time. I'll just say that I understand the applicant's priorities for the Child Care Center and the John Wayne Center, and obviously parking. These are also my priorities, but overall, I like the potential for the way it's laid out to kind of reduce the intensity as the project approaches Broadway. Appeals to me. So just generally, I'll say, based on the preliminary information that we've given, this has potential to me, subject to negotiation of certain aspects of form, circulation, and community benefits. Regarding number 3, review and provide preliminary feedback on the application to amend, I like the city's proposal for the master plan and the phasing and stages. I think having a master plan come first and then allow the phases and stages as the city has so far laid out the plan or the idea, the concept, will eliminate confusion and make the DRP process go more smoothly and keeps up with the passing of time. Regarding community benefits, I think that as a result of this development agreement negotiation process, regardless of how it pans out over the next few meetings to sort out the process, there will be perhaps a community benefit revisions, and I like, let me see if I can go through a list first that I thought about. I'd like the staff to look into what one speaker brought up this evening about community health needs assessment, well-being, and talking with St. John's, Providence St. John's about their well-being and prevention within this community, services that they'd be providing locally. I recognize, and I've experienced this recently, that community space in Santa Monica, interestingly enough, is getting more and more expensive, and it's harder to find free or very low-cost community space. So the idea of having a conference room space for the community at a regular basis and pretty frequently, as long as it doesn't interfere with the hospital's business, I find that would be to set aside that time would be a big benefit to the community, as everything is monetized these days and community space gets more and more expensive. I'd like to see the applicant reach out to not just McKinley and partner up with McKinley, the nearby elementary school, but also the SMMUSD in terms of safe routes to school, but going beyond that, what can, as a part of this ongoing multi-decade process, what can the applicant do with, for example, middle school or high school students to get interested in medicine, the field of medicine and health, being a health provider. Santa Monica has a very robust tech industry, but it would be, if St. John's can be a partner in helping middle school and high school students get into this field early on and learn it and love it, that would be fabulous. I like the idea of having free parking for cars with handicap placards in a parking structure. I like the idea of a free expo shuttle or some kind of a shuttle to take all people to and from this campus over time. The reason why the former mayor called me out by name during her testimony regarding infant and toddler services is because I was previously the chairperson of the Child Development Services District Advisory Committee to the school district, and so I'm going to put in a plug for a very important community benefit that absolutely must get renegotiated as this reopens, to please increase your support for infant and toddler services, not just on-site, but within the community. I would like to see an increased amount of affordable housing on this site, perhaps in the spot where those 10 units were, at deep affordability levels. I find it very frustrating that the units of housing that have been there have fallen into disrepair in the hands of the applicant, and this is an opportunity to make up for that. As Commissioner Fresco already pointed out, the development agreement compliance report says that the health center survey results do not meet the 1.5 ABR goal for peak periods, despite the facility implementing new TDM measures in 2014 and 2015. And it would be really helpful for staff to obviously look very fully at this document, which also says that as recent as December 15th of 2015, the staff and the health center have also discussed your plan to reevaluate the ABR survey and methodology to reflect typical weekday employee travel as time goes on. Please review that thoroughly. I have concern, and this goes to the South Campus Master Plan. I have concern about, so the diagrams that we were shown, and this is all very preliminary for us going through this amendment, but the diagrams show potential cobblestoning, and I know it's just a rendering of Santa Monica Boulevard to relate the two campuses and how people interact between them and actually how they look overall. And I am concerned about that because Santa Monica Boulevard is a main thoroughfare in Santa Monica. It takes people east and west in our city. It's our namesake boulevard. And I'm worried that if this isn't done right, and this is why I'm supporting the city's so far potentially proposed process to do this over time and have oversight over time, is because we don't want perhaps a bridge connecting the two. I actually don't have a problem with the bridge so far, but I would have a problem with the bridge and other and parts of this project going forward to make it look like Cedars-Sinai in West Hollywood, where it just becomes dingy and dark and kind of like a, sorry Cedars, but to make that kind of area just be really nasty. Yeah. This is going to become a much bigger health campus like Cedars as this goes forward, and I don't want to see it get that part of Santa Monica Boulevard become kind of like a ghost town if it's just forgotten. And I also believe in truly inviting open space for the community. These spaces must be active. I think the residents who live in this area are going to want to come down and sit on benches, play chess, do all kinds of fun things, and people will go there and walk their dogs. It could be very, very active, but only if it's done right. And so I want to see that space active. Here's my last comment if I didn't make it already. I'm sorry to have this long list, but a member of the public wrote to us about a potential walkway that would take pedestrians from Arizona and 21st through to 21st Street at Santa Monica Boulevard. And I do live in the area, not in the radius, but I live in the area. And I can say from personal experience, and also what I think would be really good for the community as a whole, would be to have that pedestrian passageway through the campus there. I think it would do the area. It would go very, very far into activating all of this space as this moves forward.
Thank you, Commissioner Kennedy. So this hospital is one of the unique features of Santa Monica, and that most communities around America would consider themselves lucky to have one super speciality hospital, and we have two within several blocks. And it is a wonderful feature of our community that we are so close to the great medical care that you need. And when we look at this hospital, we know that the occasions of service are going to go up dramatically, that you're talking about investing $2 billion here over a period of time, and that the specialities that you're already strong on, you want to spend more time and invest more and develop them. And we know that means that our community will be better served medically, but we also know that you will bring more people in to the hospital. So there are issues about having a great hospital, and that is that there is, in the immediate area, friction between the hospital and its neighbours, and that friction could be parking issues or traffic issues or simple ignorance of their needs. That was what was alluded to with the sewerage, and various other problems that they have on a daily basis. And you're a monolithic organisation, and someone who lives across the street finds it hard to relate and to have contact, and so those are some of the problems. And there's a second level of issue for the City of Santa Monica, which is managing the traffic and the parking and the people that you are bringing in here. Although the benefit of having a deep healthcare industry in a city like ours is really strong for the economy. So managing this friction and this interaction is one of the key features of this development agreement going forward. And we want you to bring the best of what you're capable of doing to our city. And so I think that, in fact, going forward, you're going to have to change the way you think about a hospital. Typically, hospitals are very static organisations that look in and conduct their research and their activities on the inside and fence themselves off from a community that they are put into for security reasons, for biosafety reasons, whatever else we want to, particularly when you've got a John Wayne Centre which will be using nuclear research, whatever it is. But we, given where you are, want you to be open and porous and invite people through your campus and invite people to the campus. And that's a change of thinking. And this plan isn't yet there. So it is important that we think about the whole acreage down there as one unified body, because that's the way you're thinking about it. So I do support this being a master plan that encompasses both sides of the campus. It obviously makes sense that the City Council be the determining factor. It's such an important part of Santa Monica going forward. They should be the authority that reviews it. And the changes in healthcare are so momentous and so fast and so important that to do a small segment of it now as part of a master plan makes sense, and then revisit both the parking and the need for the other buildings and what goes on in the other buildings is very apparent. We simply can't predict what the circumstance will be in 5 years, let alone 10, 15, 20 and even 25. But it's this opening the hospital out and making these spaces that you've got there work for people right through Santa Monica, and making this set of buildings, a set of buildings where people want to be, but you're conducting healthcare in the level above, is really important, both for your patients in terms of wellness and a lack of loneliness and so on, as for the people in our community. And it will go a long way to reducing the friction that currently exists because you're over the road and you don't care about us. But if you're inviting us onto your campus to go to a coffee shop or retail or participate in wellness or a healing garden, that does make a considerable difference. But that would require you to rethink how you interact with our community, in fact how hospitals in general do that. So that's a charge that we have to put on you. You've got 2 years, I guess, before the development agreement finally comes back to us, but that's an important element of it. In terms of the environment, Commissioner Anderson is right. I will be looking for a LEED Platinum or some equivalent. Now, hospitals are their own unique beast, and they have a variety of requirements, particularly in this case from the childcare and the housing right through to the aspects of acute and super speciality care. I don't know that LEED Platinum is exactly right, but it's that level of equivalent where you're leading the sustainability and the environmental change that hospitals are putting in place for the future. We ask that of everybody else in Santa Monica, and we would be crazy not to ask that of you, and particularly if you wish to be the leading hospital here on the West Coast. And one of the items that you did not mention in the list of things that you are going to be doing is what you also did not mention the other day when you went down your list of 8 or 9 things. You will be one of the biggest operators of parking and the biggest single garage in the city of Santa Monica. And when we add your 2,800 spaces to the 900 spaces on the campus, it's almost 4,000 spaces. We only have 6,000 publicly available spaces in the downtown of Santa Monica. So there's 2,800 and there's 900 in that above ground, or is it 600? I know, but there's another parking space above ground.
That's included. That's included.
There's another, so your private, the existing above parking structure that's on your land but leased out to someone for 50 years, that's included in the 2,800? I don't think so. No, it's not. So that means there'll be 4,000 spaces, nearly, in that location, drawing traffic from everywhere. Managing the traffic and managing the cars is an important element of this hospital going forward. And simply because you have 2,800 spaces doesn't end the discussion. It just deepens the problem that already exists in that area. And so our drive is to lessen people wanting to drive there and to stop the trips that are being induced. So when you come back, the TDM program that you've started on, and which has been so difficult already, will be deepened. It has to be. You're one of the largest employers in the town, you're one of the largest trip generators, and you drive it in a different direction from where currently we focus, which is in the downtown. I'd urge you, from the C level in your organisation, to begin those changes right now and try and push people out of cars and into the many multi-modes of transport that are now available, whether it's all those vehicles and Uber on call and Uber Pool and whatever else we wish to call it, the free EV shuttles. You can't do enough of that because that's the direction we're going. We want to be crushing and force you to change the patterns of behaviour. And having said that, I do know that where a doctor parks in relationship to his surgery is the single most important feature about his employment. And so there are some issues with that. That's just cross continents, across many decades, and it's not going to change. But the TDM issues here are really important. But for me, the community benefit that is singly the most important thing goes to the mission of this hospital and the mission of all hospitals. We're lucky to have you here because ultimately people die of something and they need to be treated for acute issues, as I know because I spent some time in your ER quite recently. And it's important that they be there. But in an America where obesity and childhood obesity is swamping every other issue of health and diseases of affluence are taking over from every other issue, whether it's diabetes or whatever else we wish to look at, and where now complex issues are coming together in single people, the idea that St John's would have a program that would run across the city and across our community in health prevention, in wellness, not just in specified areas, whether it's a school or mental health, but across our whole community, and try and lead a community into a different, better path and avoid people coming to your hospital so early and dying prematurely of the chronic diseases. I think that's an important thing for you to think about. And it's not something that's easy to do, and it's not something people have been doing per se. But we have a highly defined community here of 8.5 square miles. We have 88,000 people. We have 12,000 people living in poverty. We have people who are experiencing the extremes. This would be an important public health issue that you could make a considerable difference on, and it would be something that would be a model for everybody. And how we measure that will be a discussion point. But I'd add that in on top of the other things. My other commissioners have been extremely good and extremely detailed, but I think the bigger issue for you in the year or two that is coming is how you take the physical asset of what you've got and what you want, and how you make it work for the whole of our community, and how you take away some of those elements of friction that are impacting the neighbours in the immediate vicinity and across this whole community. And so we are lucky to have you here, and it's important, but there are issues that need to be resolved as we go forward. And given that you've asked for a DA extension, this is the right time for our community to come to you and ask you for those things. And if the Commission has nothing else, I think that closes us this evening. Thank you, and good luck as you go forward. And I'll close this hearing of the Commission. Thank you.